shining a light where the shadows creep, for the lost, the stolen, the ones who will weep. She won't turn away, she won't back down, even when the loony clowns come round. Threats don't shake her, lies don't win. She stands for justice, right till the end. Want the truth, want the best, wanna be safe as you chat. Find kids true crime, it's worth your time. She's got your back, she's on the line. YouTube, Twitter, TikTok too, Facebook stream, she'll fight for you. Some chase views, but she fights for those with nothing to lose. For the kids who vanish without a trace, she won't stop till she cracks the case. They try to silence, they try to scare, but truth don't break and she's still there, calling out monsters, showing their game. Justice comes when you speak their name. Want the truth, want the best, wanna be safe as you chat. Find kids true crime, it's worth your time. She's got your back, she's on the line. YouTube, Twitter, TikTok too, Facebook stream, she'll fight for you. Kids stand strong, she makes the choice. For victims gone, for those in need, she's fighting hard, she won't concede. Want the truth, want the best, wanna be safe as you chat. Find kids true crime, it's worth your time. She's got your back, she's on the line. YouTube, Twitter, TikTok too, Facebook streams, she'll fight for you. At the end of the day, this is all we have to say. Viper will always have her back, he will take you right in the sack.
Hello. Hi, Misty. No, you're not late. I hope you feel better. Hi, Patty Sturgis. Just in time. Look at that. Perfect timing. Yeah, that sucks. All right. Here we go, people. Are they ever going to get it? Are they ever going to get this under control? Hold on a minute. We need sound. I want to hear what's going on. All right. How is everybody? Are you off work today? Or not? What is today? Monday? No, Tuesday. I see. Okay. All right. Good. Hi, Charlotte. How are you? How are you doing, girl? Oh, that's all you do is work. I'm off tomorrow and Saturday. You don't even get a full weekend? When's the last time you had a weekend off? Just saying. So yeah, you guys, I'm getting back to my missing people that I cover, and there's another case though that if you guys don't know what the treehouse murder case was, well, I'm bringing that case back to the front, okay, frontier, because there are people deserve justice. Okay, I'll leave it at that. Patty Boo, that's therapy. I know, I know. You know, I'm really upset, guys. Wanna know why? I, you're gonna laugh. I finally got my gummy lifesavers. Yes, I did. You know where I got them? Amazon. I don't know if they're gonna be any good, you know, because sometimes you got to be careful. The stuff could be like outdated. It's just a small bag. It's no pounder like I usually get, right? Right. However, I did get some cookies, okay? They are s'mores cookies from Oreo, right? They're a mini package. I paid $5 for a mini package. I'm sending them back. Yes, I am. Is it difficult? My nurse, he was amazing. He was amazing. Did you hear that? He was amazing. Nope. Um, I can't find him anywhere. Anywhere. I don't know what's up. Because, you know, I even went to Lifesaver website, okay? All right. I was going to buy, like, you know, a lot. Charlotte and that nurse. Hey, girl. Hey. Misty, were you around for the treehouse murders case? And by the way, people, it this just came to my head. People think because I got a call from the prison in Florida, they think that it was Wade Wilson. Oh God, these people are so silly, so silly. Uh, yeah, no, it's my friend Todd. Okay, my friend Todd, and also my friend Mary was there. Also, my friend Trina is there. Okay, okay, there's that. Had to get that taken care of. Anyways, so the treehouse murder is from Key West. Paula and Matthew were unalived by two masked men, and yeah, whoa, it's something else. I'm telling you, people. You know how many people lost their lives due to that case? Very interesting. Did you? I didn't really watch. That's during the time Barb. Oh, oh, really? I thought you'd been here longer, actually. Okay, now what's going on in that courtroom? Hold on a minute. I'm going to see what they say in the comments. I'm going to look right now. Oh, what's going on? Hold on. We're going to find out right now. Okay, they already started. What are we waiting on? Of course, they're behind. They're behind. This don't make no sense. Now remember, Laurie's now asking questions. I don't have my headphones on in case I sound funny because I don't want to. I don't want to. You probably found my channel because of YouTube streets. Because I will say that about Plug. He sent people to my channel. Only time I really watched you was on Timmy's case, and she told me I needed to really check you out. So, yes, I help a lot of families. As a matter of fact, I've been on the phone this morning with family, not people I help. Okay, not my family. Well, I help my family too, but you know what I mean, right? It's so nice to help people that really, truly need the help, right? Yes, yes. Yeah. Oh, here we go. Let's do it. Come on, come on. Yes, yeah, I think it was them. The plug, that is. Oh, here we go. The no sound isn't from me. Just so you see.
What?
Walked into the house, proceeded forward, saw a patient on the floor to the right, proceeded to the patient to start an assessment and evaluation.
And then Captain Keller had already come in.
I'm pretty confident, yes, he would have been quicker getting off the truck and inside.
And so you did your assessment, and then what?
My assessment revealed that he was unresponsive, no pulse, no breathing, so I would have started CPR, started chest compressions.
Did you do that with his shirt on?
I would have lifted that out of the way so I could find the proper landmarks.
So you had said that you saw that there was, let's see, 2 gunshot wounds. Is that correct?
Yes.
And then you saw that through the shirt? Or how did you assess that when you first entered? That's my question.
Once I'm doing CPR, I can see 2 bullet holes in the shirt. I can see that on the chest and on the abdomen. I can see the wounds as I'm looking at the chest and doing chest compressions.
Okay. And then he had on what color shirt?
I wouldn't have recalled other than, I guess, the video yesterday. I think it was a dark colored shirt I think we saw on the screen.
And so you had talked yesterday about the blood being more blood on chest, not pooled around your knees, right? Is that correct?
Correct.
And so with the dark shirt, was it hard to see the blood? I'm kind of trying to see what you saw when you entered.
I remember seeing blood on the chest. It wasn't, I remember not seeing blood on the abdomen.
And there were holes in the shirt, 2 holes in the front side?
I would, best of my recall, yes.
Okay. And when did you cut off the shirt, and how does that procedure work?
I continued doing CPR, chest compressions. One of my other colleagues would have cut that off, and knowing that the shirt maybe is potentially evidence, that's why I said to her, don't cut through where the holes are. So she could have cut down the side instead of on the top of the body.
And do you use like a special scissors or something for that?
Yeah, we
Or-
have some trauma shears in our equipment.
Okay. And who was that? Was that Phelps or?
I believe that was firefighter Kaczynski.
Okay. Kaczynski, that's one I didn't have. So who all was sitting there with you that was on scene at that time?
Firefighter Fife would have been there.
Mhm.
Firefighter Kaczynski, the 3 of us, kind of like we saw in the video or I get the picture yesterday. All 3 of us around the patient, while Captain Keller was standing back a little bit, like you saw in the picture.
Okay. You said that you had been a CPR instructor for 12 years. Is that correct?
Yes.
Okay. And was that for the last 12 years or 12 years ago?
Approximate dates 2004 to 2016, let's say.
Okay. And so have you taught people who have never done CPR before?
Have I taught those individuals? Yes.
Right. And not just like people renewing their certification, but both.
Correct.
Okay. How many people would you say that you've taught that have never done CPR before?
Never done CPR, and it's probably in the hundreds over that long of doing that.
So you'd be familiar with how a first timer would react.
Yeah, you try to forewarn them what to expect.
Okay. So these first timers, they have to be taught the appropriate place to place their hands. Would that be fair?
That is part of the course, yes.
And so do you show them or do you just tell them in class where to put their hands?
It's a video-based system through American Heart. There's a curriculum that we would have been following.
Okay. So if you could only tell them like over the phone, that might be difficult for them to know the correct placement of their hands if they've never done it before.
I guess it depends on the instructions that the dispatcher gave. Ultimately, if I was telling somebody over the phone, you want to put your hands on their chest, on the lower part of the chest. It's that kind of simple, so to speak.
Okay. But without the video, if you were teaching a class and you didn't have the video, it might be difficult, right? For a bunch of first timers.
Objection, speculation.
Overruled. You can
Oh,
answer.
does it mean answer? Oh, okay. Sorry. Can you repeat the question then?
Yeah, so it might be difficult. If you didn't have the video, it might be difficult, for a bunch of first timers to know exactly what to do if you just had to tell them middle of the chest, lower chest.
You could obviously show on a person, you could show on yourself.
If you couldn't show them and you could only tell them, could it be difficult?
I suppose it's possible depending on the person.
Okay, that's fair. So do you think that your CPR class would be fairly successful if you had no visuals?
Objection, relevance, speculation.
Next question.
I got it, Your Honor. So if a person had never done it before and was just told how to do it, is it possible that they might not be acquainted with where to put their hands?
It's possible.
And it would also be possible that they might not do it properly.
That could be possible too.
And right now, when you're teaching CPR, and I didn't say you are teaching right now, but if you're teaching a class, are they just doing percussions now? There's no breathing in the mouth. Is that correct?
It's going to depend on the level of the class. As far as the lay rescuer, people that have never done it before, that just want to have the training. It's evolved and we're teaching compression only. That is a form of CPR now also, just doing chest compressions.
And how long do you teach to do that for? How long of a period before you take a rest or?
Well, it varies depending on if patient is an adult or a child. There are different guidelines that American Heart offers. So in those courses, they're getting to learn information for adults and children and infants also.
Correct, right. So for an adult, how long, like 30, 100, 150? It's been a while, so just wondering.
With an adult, they're also taught they need to call for help right away also. So that's a factor. Are they alone? Is somebody else able to call? Can they call, put the phone on speaker, start, while talking to 911? And then they would just keep going until help arrives.
So there's no timing, like you take a 10-second break, you just do compressions?
Not for that type of level of CPR, there wasn't.
Okay. So it's helpful if you had someone there that you could take turns, like I do 100 and then you do 100, because it's kind of exhausting, right?
Objection, compound question, relevance.
I'll sustain the as to compound question. You can re-ask the question ask it in a different way. Go ahead.
So how long did you administer the CPR before you did the flip over? How long do you think that was?
Before we rolled him to look at the back, is that what you're-
Correct. Yes, that's correct.
I would estimate maybe up to a minute.
Okay. And then were you counting compressions? Is that what you were doing during that time, or do you not count? You just do it for a certain amount of time?
I don't recall if I was counting. I mean, I was doing the chest compressions while waiting for the rest of the team to arrive and for us to continue assessing, see if we're going to continue to work the patient and utilize more equipment.
And there were 3 of you there.
4 total, but 3 by the patient.
Okay. And then you could take turns, right? Like trade off if you needed to.
If we needed to, yes.
So that'd be a lot easier than when you're just there by yourself. Would you agree?
Yes.
Okay. And do you know how long after the rolling over did you started doing compressions again? Is that correct?
Yes.
That's what I had.
Yes, I believe so.
And how long did you do that for?
I would estimate maybe upwards of another minute
So maybe 2 minutes total?
during that sequence, yes.
And was there another sequence?
At some point, we would have stopped doing chest compressions so we could evaluate the heart rhythm. That's on the heart monitor.
With the heart
And
monitor?
you can't be doing compressions to evaluate that.
Okay. And then you didn't continue compressions after the heart monitor at all?
From what I recall, I resumed again in brief discussion as far as what direction we were going to go.
And what were the results of the heart monitor?
There was no electrical activity.
And how long was the heart monitor applied compared to when you started the first compressions?
I'm not sure if I understand the question. Maybe you can reword it or.
Sure. How far into your treatment, I should say, did you guys stop and do the heart monitor?
I would estimate that the monitor probably was on within 2 minutes of making patient contact.
Okay. And how long does that take?
To do what? To put it on?
Well, yeah, to put it on, get a reading, and decide what you're going to do next.
It could take, I mean, you got to turn it on, open up a compartment to get the pads out of that compartment. You've got to open that packaging to be able to apply it to the patient's chest area. If the chest is wet, which there's some blood, you need to dry that so it's going to adhere more properly, read more properly. So you could be looking at 30 seconds to a minute possibly of working through that.
Okay. And did you have to do that in this case, is remove blood to stick them on?
I would assume so, but I was doing chest compressions, so that would have been one of the other 2 firefighters kind of working through that.
Okay. So I understand correctly, you said when you rolled him over, did you cut the shirt in the back also to see the exit wounds? Is that?
No, we only had to cut the shirt one time. That was when he was still laying on his back. You cut it down the side and that opens it up to where then you can remove it from the body, pull it off.
So you did pull it off completely at some point?
More than likely, I would say yes. That's typically what we would do.
Okay. But you don't remember if you did that in this case?
I know that I didn't do that. because I was doing chest compressions. So I would assume one of my colleagues did that completely. That's typically what we do.
Okay. And so you're back to doing the compressions for the third time, and then you stopped that at some point. Was there another procedure after that?
No, at that point in time is when we would have called the patient.
And who announces that?
Ultimately, I remember our captain, since he's in charge of the crew, would be considered the lead medic. He has the most experience. He's also charting the call, kind of running it, kind of made that final decision.
And that would
But-
be Captain Keller. I'm sorry, I didn't want to interrupt you.
Yes, correct.
And then he did call it at, do you know what time?
It would have, I don't have it memorized. No, it would have been like in the charting that he was doing.
And who documents that?
He would have
that time? He
documented
would have
that.
done it? Okay. In preparation for your testimony here today, did you review the 911 call at all?
No, not in preparation for today. Not the actual audio. No,
No.
no, not today. Not for this.
What did you review for today?
I was able to look at the incident times were dispatched by Phoenix Fire Department. I was able to look at the paper documentation. I was able to see my testimony from Idaho. I was able to see my testimony with Chandler PD when they came to the fire station a couple of weeks after this incident.
And what paper documentation did you actually take a look at?
It would have been the chart that Captain Keller documented.
And what does that chart consist of?
There would be scene times, date, time, address, patient information, name, address, maybe medical history, things that a narrative of what we discovered, what we've done, treatments that we've done. The heart rhythm from the monitor gets attached to it.
So that would all be in Captain Keller's report?
Correct.
And you did take a look at that in preparation for today?
Yes.
And did you write a report regarding this incident?
No.
You don't have to document anything?
Just one person documents the call.
So for all of the people that were there from fire?
Correct.
Okay. So that's the total report, is you just give your input to him and he puts it into the report?
Correct.
And that's the same for the other two firefighters that were along with you?
That's correct.
Okay. So they don't have their own individual reports as well?
No.
Okay. And what time were you dismissed from the scene?
I mean, we probably only remained an additional 5 to 10 minutes. The chart would have that time. I don't necessarily have it by memory.
So how long were you at the scene total? Like,
If I had to estimate without looking at it, I would say approximately 20, 25 minutes.
okay. And then you were like the driver of the truck, right? Was that your responsibility? So you
Correct.
drove in and then did you drive out as well?
Correct.
Okay. So if you guys arrived around 8:41 or something like that, then you left around 25 minutes later? Would that be accurate?
I guess when I was giving that estimate of like the 2025, I was even including like our dispatch time from the time we're dispatched driving to the scene. So if you're wanting to know actual on scene time, it might be closer, instead of the 20 to 25, it might be more of a closer to 20 solid. Like,
20 minutes?
yeah,
Okay. And is that typical for a call?
it can vary depending on the calls.
Okay. So what other things did you do in that 20 minutes besides administer to the patient?
So I'm including in that time while we're staged around the corner, waiting for PD to arrive, then for PD to clear the scene, for us to drive to the scene. There's the time with the patient, and then there's going to be the cleanup afterwards, removing our equipment, going outside. Maybe the equipment needs to be cleaned, restocked, ready for another call. So when we drive away, we're ready to respond to another emergency and then drive away.
Okay. So when you were done with the patient and you were going through that procedure of cleaning, were you in the house or did you exit the house?
We'll remove all of our stuff and we'll go outside, typically to the front bumper of the fire truck.
And then what do you do?
We have cleaning chemicals on the truck that we could get out to, clean our equipment up to reuse it. We've got cabinet with restock to be able to restock anything that might need to be. So we'll take care of those things to be ready to respond to another call.
Okay. And while you were out front, did you see Alex on the curb?
I did see somebody on the curb, or I don't remember if he was on the curb or standing, but I remember seeing somebody with an officer or officers. I don't recall how many people might have been together.
Okay. And did you converse with those officers at all during that time?
I don't believe so. I don't really remember conversing with any officers on scene. That would have been more Captain Keller, charting, documenting, kind of getting information from them. He would be able to answer that question.
Okay. So did you, was anybody in firefighting on your team, the four of you that were there, was anyone asked to take a look at Alex?
We were not.
Let's see. Have you spoken to the media about this case?
Can I object? Relevance?
What's the relevance?
What is the relevance, Your Honor?
Yeah.
Just to know how many times he's given testimony?
Your Honor, I'm
All right,
going
I'm gonna
to, maybe we can
hold on.
sidebar.
Yeah, I don't want to. All right, let's go on a sidebar.
I don't mean to laugh, but I'm going to laugh. Okay. He has talked. Okay. I don't know how many times. And let me say, hi, Dolly. How are you? And that's right. Alex let him just lay there for that amount of time. His life could have been saved. Just think there's going to be another trial coming up here. After this is Brandon's. I like that, it's our constitutional right to have a trial. It's our constitutional right to represent ourselves if we choose to, go pro se. But no, there's no way. Look at this judge. Okay. I'll save that. That's for sure. It'll be interesting about the phones. What in that 45 minutes, who was on the phone with who? What was going on? And she kept Charles' phone so he couldn't call for help. That's what she did. That black widow. So I'm going to take a picture for you guys of this big old thing thing of cookies I got. You guys are gonna laugh. I kind of laughed. I thought, oh my god. See, I should have looked at the small print. They get you. They get you people every time. And things like that, I guess you can't return. So there's that. Look at that guy's face. I don't know what Lori's trying to get at here, but okay, her and that female prosecutor, they're going to go tick for tat. Watch. She's going to question this guy again. They're both going to go back and forth. That's what they're going to do. Is bored and just wants attention as usual. She's disgusting. She's used to getting all that attention. I wonder how Kobe's doing. Is Kobe in Phoenix? Anybody know? Oh, he lives out there, don't he? I don't know. It's none of my business. He didn't? Okay. Oh, okay. Not sure. He has his own YouTube channel where he talks about her. Yeah. It was so funny. I remember when Colby first came on, right? He asked his mom to please to show the kids, right? Well, I played a little clip of that. He's like, Mom, just show the kids, make sure just show the kids are safe. He gave me a strike because I showed a clip of that. And then I told everybody to go to his channel. I go, here's a little clip. Colby, what did Colby do? Colby gave me a strike. Yes, he did. But then what did Colby do after that? After I talked to him, he took that strike back. Yeah. That's when he just got into YouTube. Yeah. Some creators you got to be careful of. Some creators don't care because, all honesty, okay, you could get through fair use, right? But you really got to change things a lot, right? And if someone, says, "Oh yeah, you can," right? All that can be taken back. But there's certain creators on here you have to be extremely careful of. He is. He is. I hope he can start healing someday. I mean, he lost his whole family. Oh, thank you, Charlotte. I appreciate every one of you. Just for being here. That's all. Okay, come on now, people. I'm getting a little antsy now. You know what the next thing will be, people? The judge will say, okay, let's go to break. Let's go to lunch, people. Just like yesterday. Thank you.
Okay, just a few more questions.
Okay.
Mr. Cowden, is it possible that if there was a wound to the chest, that doing compressions on that could cause other damage?
I suppose it's possible, but ultimately it doesn't matter. If the heart isn't beating, it's what you got to do. It's the appropriate treatment.
So would a common person who doesn't know how to do CPR maybe hesitate about pushing on a bullet wound?
Objection, speculation.
Sustain.
But you wouldn't.
Can you repeat the question?
You wouldn't hesitate to push on the bullet wound if the heart was stopped?
No, I wouldn't.
And you would have to assess if the heart was stopped in order to do that?
Yes, you would check a pulse like we did. We would, use our equipment like we did.
Okay. So the two wounds that you saw when you first got there, one was in the chest and one was where?
In the abdomen,
On the right side or the left side?
I would be speculating as to the specific spot or area without actually maybe seeing documentation.
Okay. And can you tell me about I think there's a word for it, but I'm sorry, I can't remember what it was. The crunch.
When doing the chest compressions,
Correct.
I don't know if there was necessarily a certain word that I used, but you feel the sternum crack. I compare it to, like I said before, cracking your knuckles.
And how much pressure would you have to apply to get the crack?
That could vary, like depending on who you're doing CPR on.
Like on an adult male?
I mean, it could still vary depending on, the strength of the person doing CPR also. It could vary depending on the size of that adult male also. So I've never seen like any science that might say you got to deliver this much pounds of force or anything.
Right,
So-
like 400 pounds of pressure or something?
Yeah,
I don't know.
Right.
Okay.
You're just
So
going to push
there isn't-
hard.
Hold on.
Sorry.
Oops, sorry.
Can't have you talk over one another. So he's finished his answer. Go ahead and answer your next question.
So there's no determined amount of pressure, correct?
Just hard and fast. When it comes to people doing CPR, for us, we're working as a team. We have equipment that can tell us if we're pushing hard enough. For a person without that equipment, just hard and fast.
Okay, that's fair. And then they don't always get the crack, right? It's not always going to happen.
If they're doing it forcefully enough, they would.
So if they didn't do it forcefully enough, it wouldn't.
That is possible, yes.
But then when you come in, the professionals, and you apply the correct amount of force, then you would hear the crack.
Yes,
And is that possible that that happened in this case?
it is possible.
Okay, no more questions.
All right, redirect.
I told you she was going to come up there tick for tat. That's what's up.
Does 911 have to regularly instruct people on how to perform CPR?
I don't know if I can answer that since I don't, do that since I'm not 911.
Have you regularly heard while listening to the radio 911 instructing people on how to do CPR?
We have had PTI information when we're responding to a call that will tell us that they are either performing CPR or being instructed to.
So you've seen in the past that 911 is prepared to handle individuals who may not know how to perform CPR.
Yes,
And that's to help try to keep the patient's blood moving while you're en route.
correct.
You were asked a lot about trading off and other people doing compressions. At this scene with this patient, Charles Vallow, did you ever trade off and have someone else do the CPR compressions?
No,
You were the only one doing the CPR compressions.
yes,
Were you doing CPR while another paramedic or EMT was getting the heart monitor ready?
yes,
So this timeline of however long it took them is in conjunction with you still performing CPR.
yes,
We talked about Charles's shirt being cut. If photographs from the scene show his shirt still around his neck, would that indicate that it wasn't removed from him?
after the cutting,
Yeah, so if
If-
police, let me ask you this. When you guys are done and he's called deceased, do you put his clothing back on or modify him in any way?
no, we would just take our equipment that's necessary to take.
So if his shirt was still around his neck, then that's how it would have been left.
Correct.
You were asked about whether or not you should perform CPR on a person who has a gunshot wound. Is there any reason why a person with a gunshot wound would not need to have blood circulating through their body to bring oxygen versus some other type of injury?
No,
Is the whole point of CPR to make sure that blood is circulating to get oxygen to their brain
yes,
so that they don't go brain dead?
yes,
And you said that ultimately it wouldn't matter if you cause more injuries because if they're brain dead, who cares, right?
correct.
In your assessment, did you feel that no one had performed CPR on Charles Vallow before you arrived?
I had felt that, and I do know in my testimony to Chandler PD, I'd stated that, or it's probably in my testimony that it was not efficient or something to those lines. But I felt like no, it had not.
Okay, you felt like no, it had not been done.
Correct.
Thank you. I have no other questions.
All right, I see at least one juror question. We'll go on a sidebar. Please, if you're a juror and you have any additional questions, pass down your question to the basket.
Hi, KB. Did they really wait that long? Yes, yes, yes. Alex did. And you know what? Alex used to work in law enforcement, people. If you didn't know that, yeah. For a very short time, he did. So he knew, okay? So now this is what I want to say. So Lori and that prosecutor do not like each other. They're going to go tit for tat. Watch. Mark my word. I mean, that lady did not need to follow up on that nonsense. She really did. I think so. I think he could have been saved. Or alive long enough to tell what happened. What do you guys think of this judge? He looks like somebody to me. What does he look like? Adam Mouse? Do you think he looks like Adam Mouse? I don't know. He's too serious, though. I can tell you
All right,
that
so you're
much.
going to come on up here.
He must have been in the military. Just saying.
Going to stand right here and be sworn in.
Please raise your right hand. You do solemnly swear the testimony you're about to give will be the truth, the whole truth, and nothing but the truth will help you God.
All right, you're going to come up this ramp over here and have a seat to my left.
Uh-oh. We got Colonel Sanders. Colonel Sanders is on the stand, people. The Colonel.
Go ahead.
Thank you. Sir, would you please introduce yourself to the jury?
My name is Kent Keller. I'm a recently retired captain with Chandler Fire Department.
When did you retire?
April of 2022.
And how long did you work with the Chandler Fire Department?
32 years.
While you were there in, let's talk about 2019, what were your duties? What was your rank?
My rank was captain. I was an engine captain, so a company officer. I was in charge of a 4-person crew. We basically respond for calls to service and the different functions of a.
Did those calls for service include medical calls?
Yes, ma'am.
Did you have any training in the area of, I guess, medical treatment yourself?
Yes, I'm a paramedic. I went to paramedic school in 1991.
And can you tell us, is there or was there ongoing type of continuing training to be a paramedic?
Yes, yes, ma'am. There is continuing education throughout the year. You have to have a certain number of hours in each subject, and as well as updates as far as pharmacology or different treatment modalities. So yes, there is constant change.
And the difference between a paramedic and an EMT?
Well, an EMT is EMTB, EMT basic. A paramedic is an EMT paramedic. So the biggest difference would be invasive treatments. So you're trained with more ability to provide care, cardiology and pharmacology.
When fire gets a call of a person who is shot, what is sort of the normal response? What does fire do when they are coming to a scene and they know a person has been shot?
Well, what they normally would do is you get the dispatch, you look on a map, you route yourself in, and then you would determine a safe place to stage while the scene is secured by PD.
Okay. And then how do you learn that the scene is secure?
In Chandler, anyway, we have interagency communication. So you're on the radio both with Phoenix Dispatch and Chandler PD, direct car to car or to Chandler PD Dispatch.
So you're actually then told by Chandler Police that it's secure and you can come in?
Yes, ma'am. They will give you a scene safe or code 4 and cop talk.
When you arrive on scene as the captain, what is your role when you get there?
My role is scene safety, primary scene safety. That's rule number 1 in everything that we do. And in other words, as I arrive on scene, I'm going to make sure with PD that there are no more threats for our crew and get direction to where we need to do treatment.
when you have this team of 4, how do you determine who does what?
Well, I mean, that's individual crew training, and some crews might have specific jobs. Ours is more of a fill and flow. As you come to, I guess I should say, one person is charting, one person is going to be the paramedic in charge of the call. So he's running the call. His job is bigger picture, and then that'll leave 3 people for hands-on treatment until a 2-person rescue would arrive. An ambulance would arrive to help if that were the case.
Does fire ever respond to a scene and then advise that a person is deceased?
Certainly.
And if fire responds, determines a person is deceased, and this is potentially a crime scene, what does fire do at that point?
Well, fire then would pick up their gear and leave without disturbing that scene as much as possible. I mean, we have gear, we spread out our gear. When we get to a patient, you know, we have monitors and drug boxes and trauma treatment boxes. So as soon as it's determined that the patient is not viable, then you would pick up that gear and leave the scene. What you don't want to do is interfere with any investigation going forward.
And even when you are working on a person, are you trying to limit impacting the scene itself to the best of your ability?
Yes, our job would be to determine if treatment is necessary and then do that treatment regardless. But yes, what I should do, what the captain or whoever that paramedic should do that has the larger picture would be to try and minimize any disturbing of the scene.
But obviously, taking care of the patient is the primary focus, even if that causes the scene to be disturbed.
Yes, ma'am.
Were you working on July 11th of 2019 around 8:30 in the morning?
Yes.
Do you recall responding to a shooting at 5531 South 4 Peaks in Chandler?
Yes.
When you responded or first went to this scene, did you guys stage like we've discussed?
Yes, ma'am.
And you advise that you're being provided information from 2 different sources?
Yes, our primary source is Phoenix Dispatch. But yes, you are able to monitor Chandler PD as well.
Is Phoenix Dispatch 911?
Yes, ma'am.
Okay. So you're getting what's coming in from 911. Are they relaying information to you?
Yes.
Are things like whether or not the patient is receiving CPR something that is very relevant to you?
Yes.
In this case, did you receive any information regarding that?
Yes. We were told that CPR instruction had been given and CPR was in progress.
Does 911, in your experience in over 30 years, are they able to provide instruction for lay people who may not know how to do 911 or not know how to do CPR compressions?
Yes, they are actually certified to do that. They train and are certified to give that instruction over the phone.
So even though it's only verbal, they've been trained to how to present that to a person over the phone.
Yes.
So you are advised that CPR instructions have been given and that that compressions are being given? Yes.
Been a little while, but yes, I believe that I was told. I do know that instruction. I do remember specifically hearing that CPR in progress. I believe I remember. I would have to, but definitely the CPR instructions had been given.
Does knowing that a person has been receiving CPR impact the way you view a patient when you enter a scene?
Yes.
How?
Well, because it would make the patient more viable. If adequate CPR were given prior to our arrival, then you would hope that good CPR was given and that oxygenated blood was being pushed around the body, which would mean that make the patient more viable at that point.
When you go to a scene where you believe CPR is given, such as this one, was that one of the things, I guess, that was part of your decision-making as you are assessing this patient?
Yes.
Can you talk to us about when you entered this residence, what do you recall?
When I entered the residence, I recall thinking that the house seemed empty, like it was either being moved into or moved out of. So there was no furniture or anything. We had a clear path to where the patient was. And I remember thinking that there's very little in this room other than the patient.
Did you notice at any point some items around the patient?
The only thing I remember being around the patient was a baseball bat and a ball cap.
And do you recall at this point where those items were in relation to him?
Yes, I believe the baseball bat would have been on the patient's right and the ball cap above him somewhere in the room. I think the baseball bat was against the wall on his right.
Do you recall ever seeing a bullet near the victim?
Once we started assessing, I did see a bullet, a spent round on the floor.
So that's sort of a little bit into, you're in
Yes,
the
ma'am.
scene.
Yes.
Wasn't something you initially recognized?
No, no.
While you're in there, was there any officers in the room with you or inside the house?
There was at least one officer still clearing the house, I believe, or at least going through the house. I only recall for sure one officer being interior.
Can you describe for us how the patient, how Charles was laying when you first observed him?
Yes, ma'am. He was laying supine. He was laying on his back. As we entered, his head was towards us, so geographically, I think north. So that's how he was laying supine.
Do you recall anything about his arms or hands where they were?
I don't. To his sides, I don't recall, honestly.
Did you observe any injuries to Charles, to this patient?
Yes, he had evidently a gunshot wound to his center chest. Hole in the shirt and a small amount of blood.
Did you recall or notice anything about where the blood was pooling from that shot to the chest?
At that time, I did not, because we have to expose the patient, and the so he's a big guy, so he had a small amount of blood above his sternum.
I'm showing you Exhibit 3 that's previously been admitted. Does that look like?
It adjusts a little bit, but
Okay.
you can attempt.
Yes, ma'am. Go ahead.
Are you able to see that there?
Yes.
Kind of. Does this look like the patient that you were working on?
Yes.
And in this, do you see the blood pooling in Exhibit 3 there?
Yes,
Is that sort of what you were talking about?
yes, here in, around the collarbone. So there's a divot here that
Would you describe this patient as a fit man?
he seemed to be, yes.
When you saw that pooling like that, did that stand out to you or seem at all impactful in your decision of whether or not CPR had been given prior to your arrival?
Yes.
Why is that?
Because had adequate CPR been given there, I would have expected more blood possibly on there and perhaps a pool of blood under him. I didn't see any blood under him. I mean, when we first got there.
So when you guys first arrived, let's go back to sort of describing the scene. You said that you didn't notice any blood pooling under him.
I did not.
And is that something that you guys are cognizant of since you're going to have to get down and around him?
Yes, but we're more cognizant of it because it would indicate an exit wound. And obviously, the more blood there is, the more the heart was beating or CPR was being done.
Okay. So both the lack of spreading on him is one indication that kind of made you question if CPR had been given?
Yes, ma'am.
And the lack of pooling of blood underneath him was another sort of
Yes.
flag to you that maybe CPR had not been given.
And no one was doing CPR when we got there. Would have been the primary indicator to me. And I say that because if CPR were in progress by PD, if there were an officer there doing CPR, then they would have continued to do CPR until we relieved them.
If a person is shot and deceased and you start giving them compressions, can you still push blood out of those wounds?
Yes, ma'am.
Now, at some point when fire arrives and they are assessing a patient, do they, I'm going to put up Exhibit 4 here. Do you need to try to remove any garments that might be around those potential gunshot wounds?
Yes, you would expose the patient.
Why is that?
Well, because you don't know for sure how many gunshots there are. You check for exit wounds. Some gunshot wounds, some entry wounds are minimal. You wouldn't see them. You know, you could go through a shirt and not see them. So you expose the patient.
Okay. I have Exhibit 4 up here from body cam from a officer that's previously been admitted. Do you recognize who these people are and where this is?
Yes, ma'am.
And is this you?
It is.
So in this case, at some point, was Charles's shirt cut in any way to allow access to those gunshot wounds?
That would be the norm. Is at this point they would be cutting his shirt.
Do you recall from this scene how many gunshot wounds you observed to the front of Mr. Vallow?
I believe 2.
Now, when you guys first arrived on scene, do you check the pulse? Like, what do you do when you first get there?
Yes, you would check for pulses, carotid pulse, and obvious signs of life, breathing, so chest rise and fall as you are walking up to a patient.
So in this case for Charles Vallow, did you guys find a pulse?
No, ma'am.
Did you notice him breathing?
No.
Do you do any other assessments before you start compressions?
No.
So if he's not breathing and you don't see that he has a pulse, why begin CPR? Why start compressions?
because you don't know how long he has not been breathing or not had a pulse.
Okay.
He could have just stopped those things moments before we got there, which would make him a viable candidate, or a viable patient rather.
And does, again, the fact that you believed CPR had been performed prior to you arriving also play into your decision to see if
Yes.
he's viable?
Yes.
As other officers are doing compressions, what are you doing there?
So I am charting. So I am, in this particular case, I was running the call. So I'm going down a checklist, gathering information, getting, listening to what they're telling me, and having them, I'm directing them throughout the call.
Okay. So at some point, are compressions stopped to assess the patient in other ways?
Yes, after a heart monitor is on.
Okay. And so are compressions able to be performed while someone else is getting the heart monitor ready?
Yes, compressions continue throughout until you stop compressions to check for pulses.
Do you ever want to check a patient who you see have gunshot wounds, such as Mr. Vallow here, to see if there's exit wounds?
Yes, ma'am, immediately. So they would have cut his shirt, taken his shirt off, rolled him, checked for exit wounds, and then rolled him back and continued compressions.
In this case, are you documenting your observations and others about what you observed when he was rolled?
Yes,
So when he's rolled, you're looking at his back?
back, right, from the back of the head to the back of the feet.
Okay. So he's completely rolled over so that you can see his back.
Yes.
Did you notice anything about Mr. Vallow's back that may have indicated he'd been there for significantly longer than you originally thought?
He did have lividity. So there was modeling, skin modeling and lividity. Once the shirt comes off, then you could see modeling on the skin, and lividity had begun to form.
Can you tell us what modeling means?
Modeling is sort of a patchy looking skin caused from hypoxia or not enough oxygen getting to the skin. I mean, you can have mottled skin for different reasons, but in this case, it would be from his heart not beating.
Okay. And then you said lividity. What does
Yes,
that
ma'am.
mean?
So lividity is the pooling of blood, and that takes longer, much longer. So the blood will begin to leave the tissues and gravity drain to the lowest part of the body.
So when the blood isn't being circulated by either CPR or the heart,
Mhm.
blood just starts to pool there.
Yes,
And so you noticed that as well when he was rolled?
yes.
Did you notice any exit wounds?
I did notice at least one exit wound, yes.
After you looked at his back, do you recall, I guess, when in this process you checked his heart monitor, when that was done?
I do not. This all happens simultaneously. You asked what these different people are doing. They're doing all of those things simultaneously. So the patient is exposed, CPR has begun, and the evaluation, the rest of the evaluation is happening. So timeline, it's on the heart monitor, I'm sure, but a lot of it happens simultaneously. That answer the question? You asked that again. I'm
I
sorry.
believe so. Do you recall what the heart monitor results were?
Asystole. No electrical rhythm in the heart. Flatline for.
Do you ever look at a patient's pupils?
Yes, ma'am, always.
What's that for?
Because if it's just a brain function. If you shine light on pupils, they react. When the brain stops to function, hypoxia sets in. The pupils will dilate and remain fixed, so they won't change. They're non-reactive to light.
What did you see with Mr. Vallow?
They were fixed and non-reactive.
So we heard about the pooling of the blood on Mr. Vallow when you first arrived. As CPR was being done, did you notice any blood being pushed out of his body?
A little bit more. Again, he is on his back. Exit wound was in his back, but yes, we increased the amount of blood under the patient by doing CPR.
When you first arrived, did you notice any active bleeding?
No, ma'am.
What's the relevance of no active bleeding?
No heartbeat.
Were you advised of Scott Cowden's information about when he started CPR, hearing the crunch or feeling, I guess, the crunch of him performing CPR?
Was I advised of it?
Yeah, did he let you know that?
No, but that would be expected.
And is that expected if CPR hadn't been performed?
No, not adequately. Again, big guy, so that the sternum will, the cartilage holding the sternum to the ribs breaks, it gives way. So, and that actually makes CPR much easier.
In this case, you came in, he wasn't breathing, he was pulseless, his pupils were dilated, the heart monitor said there was no activity, correct?
Yes.
When you looked at his back, you noticed both mottling, which meant that the blood wasn't moving through his body?
Yes, and modeling was on the front as well.
Okay.
So as that blood pools, so it leaves the tissue, that's gonna hasten the modeling part of it.
So you noticed that when the shirt was then cut and
Yes.
he was exposed,
Yes.
as well as when he was rolled.
Yes,
And then you also noticed on the back the lividity of the blood pooling there.
yes,
When you, I guess, obtained all of that information, did you end life-saving measures?
yes.
Who decides to end life-saving measures?
I do, as well as the rest of the crew. So Scott Cowden is also a paramedic, and he concurred. So then we call that in, and we cease life-saving function, or attempts rather.
When you cease life-saving measures at a scene where someone has been shot
Mhm.
and is now deceased at the scene, do you leave sort of any attached medical devices with him?
Well, as little as possible. So what would have been left on him would have been defibrillator pads, probably EKG electrodes, and probably a CPR puck.
Now, when you arrived on scene or when you were exiting, did you ever notice any male outside that might have been with some police officers?
Oh, a person?
Yeah.
Yes. One person, one male.
And did you notice him when you arrived or when you left?
When I arrived, again, my job in particular is to kind of get a larger overview of the scene. So I did notice a person talking with PD.
And when you observed this person, did you notice anything that he appeared to be injured in any way?
No,
So no obvious injuries to you?
no.
If you had been asked to treat him, would you have?
Of course.
Did you see that same person outside when you left?
Yes.
And when you left, did you observe anything about him again that he appeared to be injured in any way?
No.
Did you ever see a female and a female teenager at the scene?
Yes.
Where did you see them?
They were across the street from the house we were at.
Do you see that person in the courtroom today?
I see the adult, yes.
Can you point her out and let us know what she's wearing?
Dark blazer at the defendant's table. Dark clothes, I'm not sure.
Okay. State will ask the record to reflect the witnesses identified the defendant.
Mitchell.
Did you overhear her talking or saying anything?
I did overhear her talking with the police officers, or someone said something about not getting invited to a pool party because of the commotion at the house or something, so.
Did you have any formal interaction with her?
No.
When you sort of completed and left this scene, looking back and assessing it based upon your training, your experience, what you observed and what was done to Mr. Vallow at the scene, would you agree that Charles Vallow was dead before you entered the house?
Yes.
Based upon your training, your experience, what you observed and what was done to Mr. Vallow, would you agree that it was highly unlikely that anyone had performed CPR on Charles Vallow prior to fire arriving?
Yes.
I have no other questions, Your Honor.
All right, Cross.
Captain Keller.
Yes.
You were first on the scene?
The police department was first, but yes, we were the first fire unit.
First fire on the scene.
Mhm.
And can you explain to us what staging is exactly? I'm not
Uh,
really sure.
Sure. Staging, when there's some violent incident, the fire department, the firefighters don't have protective equipment for that sort of a scene. So we will go to a place where, close to whatever the dispatched address is, that we would be a place of safety, but close, so that as soon as the scene is made safe by the police department, then we would enter into the scene.
So that would be like a couple houses away, or?
Could be a couple
Really?
houses, could be behind cover. In this case, it was gunshot was the call. So you want to make sure that you are a little ways away,
Okay.
in case there was more gunshots.
Right. So you parked somewhere on the street, but a couple houses down from the house. Is that correct?
Yes.
Okay. And then part of that staging is you stay there until you get the all clear?
Yes, until the police department says that it's safe to enter the scene.
Okay. And you were wearing body cam that day?
No, we don't wear body
Oh, you don't
cameras.
wear body cam? Okay. You were just that was a picture from you on the body cam?
On the. one
On
of the
someone
police
else's
officers,
body cam?
yes.
Okay. Okay. Do you use any instruments to obtain current body temperature? Do you
No.
guys have an instrument for that?
No.
No? Would that help you give a more approximate time of calling a time of death?
It wouldn't help me. I'm not trained to do that. So we don't have that. It's not within our scope of practice to determine that.
It's not part of paramedics training?
No.
Okay. You explained the the modeling being patchy looking skin
Yes.
because of no oxygen to the skin. Is that correct?
Decreased, yes.
And so will that continue to increase? I don't really understand. Like would you say modeling is complete or in progress? How does that work?
I would say in progress as less and less tissue had oxygenation, I would say it continues to model.
So would you say it was in early progress or late progress? How would you estimate that?
I could not say early or late, just modeling.
That modeling was present
Yes, yes.
at that point. So how long would it take for modeling to become present? That's kind of my question.
I don't know how long.
So it could be like
different for different people, I
People.
suppose.
so it could be a minute, 5 minutes.
He's already indicated.
Hold on. Rephrase the question. I'll allow it, but make sure you let him answer before you ask your next question.
Okay. So it could be just a few minutes, possibly?
Possibly. I don't know.
Okay. And then lividity, you explained as a pooling of blood. The blood leaves the tissues and goes to the bottom. Is that correct?
Yes,
Okay. And you saw that as well?
yes.
And in your estimation, would that have happened soon? You know, well, that's not a good question. In your estimation, that had begun?
Yes.
And was it advancing? How far?
He had lividity on the back of his torso,
So does lividity,
backs of his arms.
start immediately after the heart stops? Is that what you were saying?
I suppose it does.
Okay. And if you were on any kind of medication, would that affect that as well?
I couldn't say.
And what time of death did you document? You were making the document, is that correct?
Yes, ma'am.
And what time of death did you document?
I did not put time of death, but I put a time of treatment being ceased, and I don't recall what that time was. It's on that report.
And you had stated that you were listening to dispatch on the radio, is that correct?
Yes.
So were you listening to the actual 911 operator speaking?
No, whoever is calling, if you call on the phone to a 911 operator, they would give that information to a dispatcher who would then dispatch a call with the pertinent information.
Okay, so you were getting kind of updates as it went along?
No, you get the initial call, and then if it were pertinent for us, like the scene is secure, PD says the scene is secure, go in, then we would get that. PD would call dispatch, and dispatch would then call us.
Okay, so were you aware at all that they had asked him to come outside?
No,
Okay. You just saw that he was outside, but you didn't know that the 911 operator had told him to come outside. Is that correct?
I did not know who he was or how he was involved in it.
Okay.
We arrived.
So on those dispatch updates, it wasn't saying like shooter is in-house or shooter is outside or anything like that? Okay, that wouldn't be.
Not to us.
That's what I'm saying.
That might be to the police department, but that's not something we would hear.
Okay. In this case, Captain Keller, do you know for a fact that CPR had not been given?
I do not know for a fact.
And do you know for a fact that CPR had been given?
I know for a fact that we gave CPR.
Prior to your coming in?
No.
No further questions?
All right, redirect.
Of course there's going to be redirect. Might as well.
Which do you see first, modeling or lividity? When the heart stops and the blood is no longer pumping.
Modeling.
Okay.
I would expect to see modeling first.
And you told us, I think on direct, that lividity is something that you see much later.
Yes. I would expect that, yes.
Have you treated patients before within a few minutes of their heart stopping?
Yes.
Do you see lividity in those people?
No.
Do you see modeling in those people?
No. You see skin conditions change in those people, gray or cooling, moist, moisture, but not modeling or lividity.
So you're not here to tell us how long it takes for those to form, right?
I don't know.
All you can tell us is that it's something that you see in patients who are deceased
Yes.
and have been deceased long enough, whatever time period that is, for that to happen.
Right. It is an indication of the patient no longer being a viable patient.
And that was one of the things that you noted and used in determining to end any life-saving measures.
Yes.
Now, is the only way to know if CPR has been given to be there with the person watching them?
No.
What else can tell you that CPR was given to a patient?
Well, PD on scene arriving would witness. The best way would be witness CPR.
That's the best way. Is there any other ways?
Well, yes. Again, you would have an indentation in the chest. The sternum would likely have been cracked loose from the rib cage. And there would be, in the case of trauma, increased bleeding. You do CPR or CCR sometimes when there's not trauma, cardiac.
In this case, were other indicators the blood that was pooling only at the neck and not spread out further?
Yes.
The lack of pooling underneath the victim?
Yes, and the mechanical action of decompressions with a gunshot wound right there would have spread blood in that area as well. It wouldn't just have gone where gravity is.
So where you saw the blood pooling was where gravity, a low spot.
That was my interpretation of it, yes.
And you did not observe spread blood across his chest?
No.
Would ongoing CPR movement of the blood through the body have also limited the modeling you may have seen?
Perhaps.
Ultimately, is it your opinion that it is unlikely that CPR was given to this patient prior to fire arriving?
Yes.
Thank you. I have no other questions.
Are there any juror questions? I see at least one coming down. Please pass those down. You're on the
Oh,
white
dear
noise.
God. I'm telling you. Okay. This prosecutor is, to me right now anyways, just as bad as Lori. Why do I say that? The same old, same old. Okay? We already got all the answers that were needed. Okay? No, validity, I can't even say it. Okay, when the body is deceased for a while and you see that validity, right? That means they've been gone for a while. That's what that means. In my humble opinion. Yeah. Oh, I know, Misty. Over and over and over. My daughters are here and we have things to discuss. Oh, okay. Hi, daughters. How you doing? All right. Colonel Sanders on the stand, people. The Colonel. So what's going to happen next? They're going to say, okay, it's lunchtime for an hour and a half. Why can't we hear the question from the juror? I don't understand. What is going on in that courtroom? Hey, what's going on? What's going on, peoples? Anybody know? Hey, you know what? I'm going to find out. I'm going somewhere. Okay, the juror question was there an attempt to give drug like Epridine to the patient? Keller said no. In trauma situations, it wouldn't work. Another question was ACLS protocols followed? Yes. Judge reads the third question. Was the position patched in? No. It was part of their training to determine visibility. All firefighters allowed to determine the time of death. They are authorized to stop life-saving measures. All right. Hold on a minute. Hold up, people. They're on break. Lori's got a problem with emotion. There's nothing going on, man.
All right, we have some juror questions for you. Was there any
might just
attempt to
read 'em.
gain venous access to administer medications to aid the heart and functioning, i.e. ephedrine? If no, why not?
It's not indicated for trauma. It doesn't, if there's no blood to pump or the heart has stopped pumping, increasing how fast the heart pumps with ephedrine would do nothing. So in trauma, it is not indicated.
Was ACLS protocol followed?
Yes.
Was there a physician patched in?
No, there's no patch required for cessation of treatment. It is part of our ability and part of our training to determine non-viability.
Are fire department personnel allowed to call a patient's death?
Yes. However, time of death is a different thing if that's what you're asking. In other words, we are allowed to stop attempting to do life-saving treatment if it's merely a recovery. So does that answer?
Well, what I'm going to do is I'm going to have if the defense, first of all, let me check. Are there any other juror questions for this witness? I don't see any. The defense can follow up based on those questions if you want.
No questions. No.
All right, how about the state?
Just a couple. Sir, when would you use ephedrine?
Well, if you had just asystole, but it was a cardiac-based code. If the heart had stopped due to some disease state, electric shock, for instance, you would use epi. Are you saying epinephrine
Yeah,
is what
yeah.
you're saying, right?
If so, when you're looking at whether or not to push drugs to try to get the heart to restart, you're looking at the type of trauma that caused the heart to stop.
And how long it's been since the heart stopped.
So in a place where you said there is trauma, meaning like a gunshot wound?
Like a hole in the vessel, yes.
So that is treated differently than if someone has a heart attack and
Yes. Yes.
you were asked about.
These are all algorithms, protocols that are given for us to operate on scenes under medical control to whoever asked about the patch.
What is then the ACLS protocol?
Advanced cardiac life support. And it's just, again, it's a flow chart. Are there obvious signs of death? Yes. Stop CPR.
So here you followed that protocol and stopped CPR.
Yes, ma'am. CCR technically, but yes.
You were asked about contacting a physician, a patch or something for a cessation of treatment.
Right.
Are there times where you do patch in with a physician?
Sure. You would patch en route, not for a code. You would patch en route and give a doctor, or actually it would be a nurse answering the phone, but you would let them know what you have and what treatment you have given and what treatment you are going to give en route to their facility to continue care. We are primarily to stabilize and turn over the patient, making it more viable for a rescue.
So when you terminate treatment because a patient is not viable, you cannot revive them, you don't need to talk to a doctor about that.
No, you you need to call in that you did it. So there would have been a patch after that, but you don't have to call in to cease treatment.
So you don't need a blessing by a doctor to stop life-saving treatment.
Well, no, we have the blessing through our certifications and through our training. So we are operating under a doctor's license at any time we are operating. So that doctor or this group of doctors usually understands our training level and agrees to trains us to make that decision. Yes.
And so ultimately, as a paramedic, you have the authority to use that protocol to determine when you are no longer able to revive or
Yes.
save the life of a patient.
Cease life-saving functions. Yes.
And that's what you did here.
Yes, ma'am.
Thank you. I have no other questions.
All right, you can step down. We're going to take our lunch recess. I'll remind the jury of the admonition. We will resume at 1:30 p.m.
All rise for the jury.
Okay, we are going to go. I'm going to read this here real quick, people. This is what Nate says. All right, where are we? Okay, so what's going on? Trina says a motion Lori filed yesterday needs to be discussed at one point. Apparently, it was a motion about a discovery violation. The motion deals with Lonnie Dworkin, Lori's expert witness. Trina says we need to know what he permitted or able to bring into the trial. Judge asked Lori if she wanted to argue that motion right now. Lori says no. Judge says, "What do you want to argue it?" Lori says, "Do you want me to argue it right now?" Judge says, "There does not appear to be a discovery violation." Gursky says it's more likely a discovery request, not a violation. Lori said she would agree with him. The problem that we have here is software, and those things were available. They were not handed over from the state. Unclear of what she's talking about. Lori says the complete downloads were never given, just reports. And then Lori says that the state didn't have anything over from the technology downloads and request a separate hearing. Judge says he will think about it and maybe have the hearing on Friday. Okay, you guys look at this. I don't want to put on my headphones. Hopefully my sound is all right. There's a guy. Let's watch this news anchor because Lori's got one of those stun belts on. Okay. Let's watch what happens to this guy. Let's watch. Let's laugh a little bit.
Seconds, so I didn't put the belt all the way around me and fasten it. Still.
Ah, jeez, Louise. Woo! I get it.
Wasn't that bad? It was terrible.
Oh my God, that's funny. You guys think that's funny? I'm sorry. Why is it when you see people get hurt, you laugh? Oh my God. Well, you know, I don't mean, you know. If it was me, I'd be laughing. I'd be laughing at myself. That's what I do. I laugh. Okay. All right. Let's see here. I want to see if we can find another video. Oh my God. Defendant received. Okay. Let's see. I wonder if a defendant ever got free. I wonder what has anybody heard of any action? A video that somebody was wearing that belt and they tried to run but got stung instead. Snorkeling. here I'm on mute over here, right? You guys, only if you knew. I'm laughing so hard over here just because. It's funny. I'm envisioning it in my head. Oh my god. Oh my god. Oh. Oh, this, this is wonderful. Let's watch it, people. Let's watch. Oh.
They just didn't give us the entire extraction. They gave us the reports of the extractions, the ones that they wanted us to have. So those were available according to the technology. They just didn't give them to us on all of the devices, but we only have proof of it on one device because that's the only device that we were able to do in a timely manner.
All right. I want to clarify a little bit. They gave you the full extraction that was available to them at the time.
No, they pulled a report from the full extraction and gave us that. That's what they gave us.
State want to respond.
Your Honor, when you extract data from a device like a cell phone, it is put into a formula where it is not readable by anyone, which is why then you use the Cellbrite technology to basically parse that data into areas that we can read and view and review. So
Is that what was given to the
that is
defense?
what was given to the defense, was the 2019 or 2020 version of the Cellbrite technology that was used to take that extraction and put it into a readable form so that you can look at, for instance, not having to search through all this data to try to find out a text message. All of them are put together with dates and times and people and locations.
Your Honor, I would request that we can have a hearing on this so that I can bring in Lonnie Dworkin and he can explain that what they did not give us.
Well, just reading his affidavit is what they gave you is what they had available to them at the time. There's no affirmative duty for them to, every time a new software version comes out that makes maybe more data available, to rerun all the information.
We're not claiming that it is. We're claiming that they had a full extraction and they gave us a report of that full extraction instead of the full extraction on all the devices. It's not what only was available to them. They did have that available. They just didn't give it to us. It's cherry picking. It's
Okay.
cherry picking is what
Well,
we got.
I don't read your own expert's affidavit the same way you're reading it, but
That's why I'd like him to be able to come in and explain it. Can we set that up?
well, we can set that up at some point, but again, this is all late and it's unlikely that anything that's happening would lead to him being allowed to testify, but maybe we'll do that this Friday or something. I don't know. We'll have to squeeze it in, but I'm not going to make the jury wait to do that.
Okay.
We'll be at recess until 1:30.
So there's that. Lori needs to quit playing with her hair. She needs to put her hair up and quit touching her hair. If she wants to be a professional, all right, get that hair out of your face and quit touching it. Just saying. But what I will say, I think she's doing well as her own attorney, right? It's driving me nuts that the prosecuting attorney now is following up on everything she talks about. I mean, there's no reason for it. There really ain't. But hey, I'm no judge. Okay? I'm no attorney. This is just my opinion, not facts. All right? So what should we do? What should we do? We got an hour because remember they come back. Oh my God, what is that? Who? Oh, people, people. Look at this. I mean, some of the stuff I don't know why I watch. See those little creatures? Those little creatures. People eat that. See right there, that creature. Gross. All right. Oh, look it's Kobe's birthday today, people. It's Kobe's birthday. Happy birthday, Kobe. Happy birthday. Let's say happy birthday. Happy birthday. Crime. Get your crime crew. There we go, people. Celebrate. Party. No, party. There we go. There we go. He's only 29 years old. Let me tell you, he's had a life. He's had quite the life. Oh, in an hour. In an hour. Okay, let's see what else is going on. Hold on. Tomorrow is my son's oldest birthday. He'll be 32. That's your oldest? Okay. My oldest is going to be, how old is he going to be? 38 or 39? I'm going to figure this out. 38 or 39. Ain't I terrible? And then one is 36 and one is 33 and 31. So it's going to be 32, 34, 36, 38. There we go. There we go. Set of three. My baby is 31. Okay, I'm going to go look for something. Hold on. Two boys, two girls. I went boy, girl, boy, girl. Okay, we are going to listen to this. We are going to listen to text messages. Oh, hold on. All right, these are text messages and emails between Lori, Chad Daybell, and Charles.
Detective Duncan, do you
Hold on.
recognize the message in front of you?
I do.
And do you recall what email this was associated with?
This was an email associated with kkwalker75@yahoo.com.
Was a copy of this located on Charles Vallow's device?
Yes, it was.
Could you read that for the jury?
It could be possible to have a hard copy to look at. Too.
If the court will allow it, I do have a hard copy available.
Yes, that's fine as long as it comports with what's being displayed on the screen.
And I will indicate for the record, the printout that the detective is being handed was printed directly from the PowerPoint.
Okay, with that in mind then, and obviously we can follow along with what's on the screen. I'll allow him to have that printed copy and review from that.
Thank you. So the email reads as follows. Hello, Chad. I hope you are doing well. This is Charles Vallow from Arizona. We really enjoyed having you stay with us back in November when you came to the Preparing a People conference. I appreciated you taking the time to talk to me about the book I've been working on. Well, more than 6 months later, I still haven't made much progress on it, but I feel an urgency to get it done. As the managing partner of Right Planning Group, I'm going to have the opportunity to speak at various conventions beginning in the fall. But everyone says I need to have a book available that summarizes my life and shares the principles I follow. So I will cut to the chase. I am willing to pay you well to help me get this book into shape as a ghostwriter. I really liked your autobiography and the tone you took in sharing experiences without preaching. Is there any way you could come here for a couple of days and help me get the book underway? I feel talking in person would be much more valuable than a phone call or video chat, mainly because I would like you to read through some of my journals and explain to me how the publishing industry works. It would help me know whether I truly have a book in me and whether you want to team up on it. I played minor league baseball and have had plenty of stories that my audience could relate to, along with the knowledge I've gained running my own company. So I do feel the book would contain valuable information even beyond the convention circuit. I'm out of town until Sunday, but I would gladly fly you down here early next week before the holiday and cover your expenses. You can stay at our guest room like before, or in a hotel if you prefer. I hate to take you away from your family, but I know this book is vital to my speaking success.
Isn't this just gross? Mind you, this is Charles telling Chad, asking for his help, because he's a publisher of a book. But here at this time, he was already having an affair with Lori. The first time he stayed there, in his home. In his home. Chad's evil. Chad is very, very evil.
I understand if you don't want to take part in the project, but I would definitely make it worth your time. With admiration, Charles.
And you indicate this came from an email, kkwalker75@yahoo.com?
That is correct.
Did you do any kind of investigation to try to determine who the owner of that account was?
So I authored a search warrant to Yahoo. I was able to obtain the subscriber information for this account of kkwalker75@yahoo.com. The name associated with the account was Karen Walker. The IP address or the internet provider address associated with the account came back to Katy, an area of Katy, Texas.
Okay, so Walker is Charles' ex-wife. Oh my God. Hey girl, how you doing? We're just on a break. We're on a break. But this Lindsay Blake, this prosecutor talking, she's a good one. She's a good one.
Also, the phone number associated with the account came back to Lori Vallow. The date of birth on the account came back to a variation of Lori Vallow's date of birth.
Was there any indication that this email account was linked to Charles Vallow?
There is no indication.
In going through Charles' phone further, did you locate anything regarding whether or not Charles actually sent that email?
There's nothing to indicate that Charles sent this email to or from his device, KK Walker. However, he did forward this email to Adam, Lori's brother, as well as discuss the email with Lori through text messages.
If you have to wipe yourself raw just to get clean, do this. Stop.
And looking at the next page there,
Yes.
are these some of the messages that you were referring to?
Yes. Charles had discovered this email on June 29th of 2019. He then forwarded it to Adam and then confronted Lori about this email that was sent. Based on my observations of Charles's email or his accounts that were analyzed, like I said, there's no indication that this came from Charles' account, was created by Charles or sent to Chad. To the best of my knowledge, looking through Charles's information, he had no relationship with Chad Daybell at all.
And if you could, would you read the messages on those and just indicate who they are coming to and going,
Yes.
they're being sent to?
The first one is Charles to Lori. It was time-stamped June 29th, 2019 at 5:51 a.m. The UTC is a universal coordinated time, and the -7 is done to show that that would be Arizona time. So at 5:51 on June 29th, 2019, it says, "Is he with whom you're having an affair? He did not stay with us in Arizona in November. Who are you lying to now? Trying to destroy another family? You're evil, period. I may take JJ back to Houston unless you have a great explanation for all of this. I will not let him be a party to your apostasy." Charles to Lori again at 6:04 a.m. "Just so you know, I have Tammy's, Chad's wife's, email address. I will send a copy of my email you sent to KK Walker. Tammy will know what you're up to. You better explain." Charles to Lori at 6:10. "I now have Tammy Daybell's cell number. I'll text her a copy of the letter and an explanation of what you're up to. You have till noon your time to explain, or I'm sending via text and email to her." At 6:55, Charles sends Lori a message. "I'm sure you are up by now. You have until 10 a.m. your time to respond, or I send the emails and texts to Tammy." Charles to Lori at 12:23 p.m. "Just so you and Chad know, I am going to talk to Tammy. In person if I have to. I've already emailed and texted her. Your game is up." Charles to Lori at 5:04 p.m. "Please stop spending money on the credit cards. I appreciate it." I was in looking at Charles's phone extractions, was able to determine that 2 emails were sent to Tammy Daybell, one to her personal email and also one to her work email.
Yeah, I apologize. I'm having trouble hearing counsel. If she could just move the mic a little bit closer.
I had actually muted it, so I
Oh,
apologize.
okay.
Thank you for saying that. Looking at that next page there, are those the emails that you were referring to?
Yes, they are.
And would you read those into the record?
The email from Charles Vallow to Tammy Daybell at the tdaybell@sugarsalem.com would be her work email on June 29, 2019 at 9:16. "Tammy, my name is Charles Vallow. I have some vital and disturbing information regarding your husband and my wife, Lori. This is your work email, so I'll wait to send you the evidence that is very disturbing. You may call or email me from the address where you can receive the information. I apologize to be the one sending this, but something has to be done. I feel it's best if I shed some light on this issue. Regards, Charles Vallow. And he provides the phone number of 714-853-5005. He sends a second email from his Charles at Right Planning Group email address to tammy.daybell@gmail.com on June 30th at 2019 at 10:16 a.m. The subject line in the email is "Your husband and my wife," and the body of
Do you hear that? June 30th, 2019. So Chad put down Charles has gone dark. He's gone dark. It's time. And on July 11th, his life was taken. Look at Chad. Look at him. Ew. Yeah. Just saying.
the email reading are having an affair. Her name is Lori Vallow. I've got definitive proof if you care to see it. Contact me and I'll share it with you. It's devastating, I know, but the truth needs to be shown. Charles Vallow.
The one and only Botox Cosmetic, FDA approved for over 20 years. Book a consultation at BotoxCosmetic.com.
I always wanted to be a teacher since I was little.
Marisol Castro has been.
And from your review of the device, were you able to determine whether or not Tammy Daybell would have actually read these emails?
I did contact at least Sugar Salem School District and asked if those were read. There's no indication that they were. They said they could have been read and deleted, or just deleted, but there's no indication. They do show on Chad's part to be sent, though.
And you said Chad's part.
I'm sorry, on Charles's part. My apologies.
Were you able to determine whether or not there was any communication from Charles Vallow to Chad Daybell?
Yes, on the 29th of June, 2009, the PowerPoint actually is 209, should be 2009 at 9:32 a.m. Charles sends Chad Daybell a message at chad.daybell@gmail.com. The message reads, "Chad, I'm Lori's husband, but I gathered you already knew this. She sent an email yesterday, supposedly written by me to KK Walker, inviting you to Arizona next week and to ghostwrite a book I'm supposed to be working on, or supposedly working on. It's preposterous. I happened to run across it as she left her computer at our Houston home. I am not paying anybody for anything and I'm not writing a book. Either you or Lori need to tell me what's going on, or this will be exposed for all to see. Regards, Charles Vallow." And again, leaves the number 714-853-5005. Goes on to read, "And does your wife know you have several of Lori's dance videos? Explain how that is any way appropriate. She sent them to you at your request in January. Charles."
Were you able to locate any response from Chad Daybell to Charles' email?
There was no response.
Did you also locate messages from Charles to Lori?
Yes, there were many messages between Charles and Lori on the 29th arguing about this particular letter that was sent.
Do you also recall the next slide locating that message on the phone?
Yes, I do.
And could you read that message?
The message from Charles to Lori on June 30th, I believe that should be 2019, of 0842. "Lori, I know you don't care how I feel, but just imagine this. How could my actions or breaking your heart result in what you've done? You accuse me of infidelity, but it's you who have been having an affair. It just keeps killing me. Maybe that's your goal. How can you live with yourself destroying our life, Mel and Brandon's, probably Mel and Brandon too? Now add Chad Daybell family and you've got a home run. The fact you will continue to go to the temple after all you've done shocks me. There really is something wrong with you. I really don't want to do what I have to do, but you have to be exposed for what you really are. You won't even deny it or talk to me as to your reasons. That's what's amazing to me. You could ally some of what's about to happen, but I don't think you will. Lying has become second nature to you. You have been impressive in blaming me for all that's happened. You have destroyed me. I've never been lower in my life. It's you that has done it. Please tell me why, please. I will slow or minimize what's about to happen. It's you who has caused it. We have a son to raise, but that's all we have in common. I will work with you in his best interest and will be there Monday evening. You owe me an apology for all the false accusations you've made. You know, I've been entirely faithful to you since the first day we met. I deserve an apology from you. Please respect that much.
And you indicated that message when you located it would have been sent on June 30th of 2019.
Correct.
From your review of Charles' phone, did he appear to be trying to work on his relationship with Lori?
In reviewing Charles's phone, there was a lot of obviously frustration and anger that he would start with, but then he would come back to a loving, gentle side and wanting to work things out and be more reasonable. He would.
Was Lori always responsive to his messages?
Not always. In this particular case, there was no, I didn't see any denial or acceptance of the particular email that was sent, but they would still converse with each other.
Do you have old pictures on your PC or smartphone? Then this video is for you. Nobody believed me at first, but now everybody wants one. My friends roasted me for getting scammed into buying a flash drive for 35 bucks. But once I showed them what it could do, they begged me to reveal the brand. It's called PhotoStick Omni, the device that shocked tech experts and disrupted the cloud storage industry. Designed with cutting-edge file detection and backup technology, which allows it to find, organize, and securely store every single photo, video, and document automatically. This process ensures
And looking at the next page there, are those also additional messages that were located?
Yes, the additional messages going into July 1st, 2019 at 10:31. Charles to Lori, I'm going to Idaho first to meet with Tammy Daybell. Lori responds to Charles a minute later. She won't see you. She is my friend. She won't listen to you. Go ahead. You are ridiculous. Are you coming to JJ for the 4th or not? Charles responded to Lori July 1st, 2019 at 10:37. Then you tell me why you used my name and fictitious email to send a BS email about a book I am having him ghostwrite for me. It's fraud and a lie. There's no reason for it other than to get him in Arizona and have an excuse for his wife. Charles to Lori, July 1st at 10:38. You did this. I had nothing to do with it, and you know it. Also, he did not stay with us in November. I will find out.
And those messages are sent on July 1st of 2019.
That is correct.
And when did you respond to the report of a shooting?
We responded to the report of the shooting on July 11th of 2019.
And just to remind the jury from yesterday, when you arrived, Charles Vallow was in fact deceased.
Yes, he was.
Looking at that next page, did you also locate those messages on Charles' device?
We did, yes.
And can you read those messages?
This would be the July 11, 2019, shortly before the murder of Charles Vallow. At between 7:35 and 7:37 in the morning, Charles sent Adam Cox a message that says, Al is here. Adam responded, at Lori's. Adam then states, really? I wonder why he never called me back. Adam said, they are planning something. Charles responded, absolutely. Adam then responds, I was supposed to spend the night at his house last night. She probably blocked that. And then Charles responded, what you do is up to you.
After that message, are there any other messages from Charles to anyone?
After that message, there are no other messages. There are messages sent to the phone, but nothing was read by Charles at that point.
And those messages took place on July 11th, 2019, between 7:35 a.m. and 7:37 a.m.?
Correct. And in addition, Charles' phone had his location services on, and the location.
No, I'm going to object. This is non-responsive to the question. He's adding. Thank you.
Were you able to determine anything else from Charles Vallow's phone?
Yes.
And what was that?
Charles had his location services on, and the location of that device at the time those messages were sent was at the 5531 South Four Peaks Place in Chandler, where the homicide took place.
Your Honor, I would next go to what has been marked as State's Exhibit 48. And I believe both counsel and the court have a copy. And Your Honor, would you like the jump drive marked with an exhibit sticker as well to match the paper printout?
I think that would be helpful, yes.
Your Honor, one of my co-counsel will get that marked and submitted for the court.
Okay.
And Detective, I believe you've been handed that exhibit.
Yes, ma'am.
And I believe it should be Exhibit 48. Is that what it says on the back?
That is correct.
Making sure we got you the right one. In looking at that, do you recognize what is on that?
Yes, the front is the address of loriforstyle@icloud.com, and then 4 phone numbers that are associated with that account.
And if you can flip through that.
Here's to sneaking away to Wisconsin, to swimsuit-only dress codes, and
I just wanted to make sure. So the first 4 pages are Lori for Style, and then or 5 pages, and then it breaks into a different iCloud account. Do you want those separated or all together?
We'll keep them together for now.
Okay.
Do you recognize the information located within those papers?
I do.
Do you recognize that as information that was located from a search that you did?
I do.
And what accounts were you looking at?
So as indicated before, the first count I was looking at is Lori for Style at iCloud.com. When looking through the Lori for Style iCloud and examining the data from that iCloud account, I uncovered the iCloud account of LollyTime at iCloud.com.
Did you also look through phone records for Ms. Vallow?
Yes, I did.
And is some of the information in that slide indicative of, and I can actually point you to the page number. In looking at the 8th page in there.
That is correct.
And would that be information that you had found through a search of the phone records?
Yes.
Your Honor, the state, well, let me ask this. In looking at these, and did you assist in preparing these?
Yes, I did.
And are these helpful as a summary for your testimony here today?
Based on the amount of data in the iCloud accounts, they are very helpful, yes.
Given that, Your Honor, I would ask for the admission of State's Exhibit 48.
Any objection from the defense?
We would just like to state for the record that we have objected to all this information under 404B, and the state has overruled that objection. But we don't have any objection to this particular one. We just want on the record that we had previously objected to this.
All right, the court would note that there has previously been determinations made on the state's request for evidence under 404B. The court did make a ruling on that at a hearing on February 22nd of this year. And for the reasons incorporated in that decision, it was determined this could be submitted under 404B. In terms of the summary that's been offered as Exhibit 48, without further objection, then the court will admit Exhibit 48.
Your Honor, similar to the last exhibit, there also is a electronic PowerPoint presentation that has been put on a jump drive. We will also mark that and submit it to the court, but we would ask to be able to publish it to the jury at this time.
Okay, with it being admitted, then it can be published, and we'll keep the actual exhibit will be the PowerPoint digital file on the jump drive.
Detective Duncan, you talked about looking at the Lori for Style at iCloud.
Yes.
When you start looking at that account, does it provide identifying information?
So the account information provided by Apple would include information such as the IME number, which is the device ID. Basically, it's a fingerprint for the device associated with that iCloud account. It provides phone numbers associated with the account, and it could also include recovery email addresses.
And with regard to the Lori for Style, did you locate phone numbers associated with that account?
Yes, I did.
And what were those numbers?
The phone numbers are 808-755-5452, 480-692-9562, 480-489-4652, 512-626-2714.
Were you able to determine who the Lori for Style at iCloud.com account was linked to? What
Yes.
individual?
Yes.
And who was that?
The account is linked to Lori Vallow. The number of 480-489-4652, I recognize as a number that is linked back to her.
And on that iCloud account, were you able to recover some messages that had been sent?
I was.
Were you able to recover some messages sent between Lori Vallow and Alex Cox?
Yes,
And looking at that second page, do you recognize those messages?
I do.
And could you read those, including the dates, into the record?
On 3/9 of 2019, Lori sent Alex a message that says, apparently it is tied to Ned being gone, hopefully today or tomorrow. The following day, 3/10/2019, Alex sent Lori a message, love you too, have fun, and get rid of Ned already. 3/26/2019, Alex sends Lori a message, Ned is still alive, just confirmed. Lori responded on the same day to Alex, it's not Ned, and it's a new one.
Through your investigation, were you able to determine who Ned was that they were referring to?
So at the beginning of this investigation, or in the following weeks, I apologize, the following weeks, we were informed that Charles was possibly murdered as a result of being a dark spirit or a zombie. We did receive information that, and through Charles's contacts and conversations with especially Lori, he mentioned that she would refer to him as Ned or Garrett. So those were names. Through the investigation, we found out that Charles was being referred to, or the spirit in Charles was being referred to.
However you book your car, first check Kayak to filter your rental search by car type to find exactly what you need. Then do what people do. Remember your bald spot. Look at other people's bald spots. Look for solutions. Buy ahead.
Did you also locate some messages between Lori and some other women on the date of Tammy's death?
I did.
And looking at that next slide, do you recognize those messages?
Yes, I do.
And could you indicate who those messages were between and when they were sent and the content of them for the record?
So the messages are between Nicole Earl and Lori Vallow, and they are on 10/19 of 2019. Nicole sends Lori a message at 9:18, says, I'm not sure if you heard, but Chad's wife died last night. Lori responded at 9:33 to Nicole, oh my gosh, I did not hear that. I'm in Hawaii and it's 6 a.m. Lori then responded to Nicole at 9:34, do you know what happened? Nicole sent Lori a message at 9:37, yes, she awoke in the night coughing, threw up, collapsed, and passed away.
And looking at that next page, do you recognize those messages?
Yes, I do.
And could you indicate who those messages were between, the date they were sent, and the content of those messages?
These messages were between Lori Vallow and Melanie Gibb and dated October 19th of 2019. Melanie sent Lori a message at 13:16 hours. I heard what happened to Chad's wife. Oh my gosh. Lori responded to Melanie at 13:18. Hello, what?
And looking at the time on that slide compared to the prior slide, was that later in the day?
Yes, it was.
Did you find any indication in those messages where Lori tells Melanie she's already been informed of Tammy's passing?
I did not.
Did you also locate messages between or messages sent from Lori to Colby Ryan?
Yes, I did.
And looking at that next page, do you recognize those messages?
I do.
Could you indicate the date they were sent, the sender and receiver, and read the text of that message?
On 11/22 of 2019, there's text messages from Lori Vallow and Colby Ryan. And or from Lori Vallow to Colby Ryan. Lori states, I text Ty to send it, but I haven't heard back yet. She will probably just do it before she tells me. Then she then states, hope you got that. Hope you got the Venmo. Ty said she sent it late. I'll call you when I get a break. Hope you're having a great day. I love you so much.
Do you know who the Ty is that they were referring to?
That would
Objection calls for speculation, Judge.
We need more foundation for that to be answered, so I'll sustain that for now.
Based on your review of the phone and the iCloud account and the contents of it, or other iCloud accounts, would you be able to determine or know who the Ty is they were referring to?
I would.
And who is that?
Tylee Ryan.
Then we talked about that you went through another iCloud account.
I did. Through searching the Lori for style, like I stated, I was able to uncover a lollytime at iCloud.com.
Were you able to determine when that lollytime account was created?
Yes, I was.
When was that?
That account was created on July 1st of 2019.
And on Charles' phone, when you'd located the messages regarding the affair, do you recall the date that Charles was sending those messages to Lori?
I believe that was June 29th of 2019.
And then this lollytime account is created on July 1st?
Correct.
Similar to the Lori for style, were you able to determine any identifying information as to who the account holder was?
Yes, this account was actually linked to a different IMEI number, so a different device. But the number of 480-692-9562 was shared between both accounts.
And were you able to determine who the owner of this account was?
Yeah, based on the examination of this account, photographs, correspondence, videos, audio information, the account belonged to Lori Vallow.
And in this account, were you able to locate messages between Lori and Alex?
I was.
And I guess to be specific, would that have been Alex Cox?
Yes.
Going to the next page of this, do you recognize those messages?
I do.
Could you indicate who they were sent to and from, the date, and read them into the record?
Yes. The text messages, or the messages are from Lori Vallow to Alex Cox, and dated 7/9/2019, the first one at 13:49 hours. Lori sends Alex a message. So the plot thickens. Call me when you can. Lori then sends Alex a message later that night at 21:50 or 9:50 p.m. Getting sleepy, so I'm going to need you to stay close to me the next couple days. Mel too. She can't go to Utah. They are planking some kind of intervention, but want Mel out of the way, so I'm left alone. I need to come get the stuff at your house tomorrow and secure it. Lots to do. Thank you for standing by me. It's all coming to a head this week. I will be like Nephi, I am told, and so will you.
And are these messages transferred over the way that they were found?
They are, yes.
Some of the messages may contain typos or spelling errors.
Absolutely.
When you're looking at different accounts and different devices, are you sometimes looking for the lack of information?
Yes, absolutely.
Do you compare different information found from one device to another or one account to another?
Yes.
And did you in fact do that in this case?
I did.
And looking at the next page, were there messages? Let me back up. Was there evidence of messages located in Lori's phone that did not appear in the iClouds?
Yes, there was.
And looking at this and at this page, were there any that drew your attention?
Yes, there are.
And could you indicate what those are?
So I'm creating a timeline for the death of Charles Vallow, specifically the messages that were read earlier regarding Al being at the house and when Charles' phone stopped responding, or Charles stopped responding to Al. We just created a time frame, or kind of a timeline, if you would, of the events that happened.
If you're a woman weighing over 180 pounds, you need to try this. I was 183 and I got down to 152.
There were several messages on Lori's phone, her actual physical phone, not the message itself, but an indication that a text message was sent that was not located on the iCloud, which is not uncommon. The messages were important to us in our investigation, as they are text messages that between Lori and Chad that occurred right before the murder of Charles Vallow.
Did you also locate additional communications between Lori and Chad on that iCloud account?
Yes, I did.
And looking at the next page, do you recognize those messages?
I do.
And could you indicate who was the sender, the receiver, the date, and read the message into the record?
Yes. The following are text messages between Lori Vallow and Chad Daybell on 7/18. That should be 2019, not 2018. Lori to Chad. I just got the letter from the insurance company saying that I am not the beneficiary. It's a spear through my heart. Who do you think he changed it to? Brandon or probably Kay? He left nothing for JJ. Chad responded to Lori, wow, that's terrible. There's no way to find out. Lori responded to Chad, I might be able to see when I get his computer on Sunday. I could check. The emails sent to the insurance company. It will show change of beneficiary. He must have done it recently. Chad responds to Lori. It seemed you would have had to agree to the change. Maybe your name was forged. You should have a good paper trail to prove it.
And again, these messages would have actually been sent on July 18th of 2019.
Correct.
So these messages were exchanged 7 days after the death of Charles Vallow.
That is correct.
Did these messages indicate anything to you as to whether or not Lori seemed to know she was not the beneficiary?
Yes.
Did it appear that she had just found out she was not the beneficiary?
Yes.
Did you find any indication that Lori knew she was not the beneficiary of a life insurance prior to Charles' death?
Prior to Charles' death, no, nothing.
Did the information you found lead you to believe she did not learn she was not the beneficiary until after Charles was deceased?
That is correct.
And looking at that next page, and again, I think it says July 18th of 2018. That should be 2019.
Yes, ma'am.
Is that correct?
Yes.
And are those additional messages that were located?
They are.
And could you indicate for the record who sent them, who received them, the date, and read them into the record?
So on 7/18 of 2019, Chad sent Lori a message. I love you. This is terrible, but it is probably another step in bringing down the Gadiantons, especially Brandon. Lori responded to Chad, nope, he can change it anytime he wants. He's the agent, and anyone can change their beneficiary anytime with their own signature. I'm thinking it must be Kay. Chad sent Lori a message. It will be interesting if he got it changed after he had 2 bullets in his chest.
Was there an additional message located?
Yes. On 7/18, 2019 at 12:19 hours.
Did you hear that? What Chad said? Oh, it'll be interesting to find out if it happened after he got 2 bullets in his chest. You know what? He's lucky he's in Idaho. Anywhere else, somebody would hurt him.
Lori sent Chad a message. So I talked to the insurance company. He changed it in March. So it was probably Ned before we got rid of him. They can't tell me to who, of course, but it's done. I'll still get the $4,000 a month from SS.
Your Honor, I'm going to object to the actual form of what he just read.
Let me review the record briefly here.
And Your Honor, I think I know where counsel's going with this, and we could maybe just have him reread the last line.
That'd be fine.
Okay.
I think a word was added.
Let's have him reread that, please, so it's accurate.
I'm sorry. I'll still get the $4,000 a month from SS.
Thank you. Does that?
That does comport. Thank you.
Thank you.
Looking at the next page, do you recognize that message?
I do.
And can you indicate who had sent that message?
This is a message found on Lori's device, the lolly time from Chad to Lori, dated 7/26, 2019 at 8:13 p.m.
And could you read it into the record?
Tonight, I figured out who I feel like. I'm a grown-up version of Harry Potter who has to live with the Dudleys in his little space under the stairs. Every few weeks, I get to escape and have an amazing adventure and have amazing adventures with my goddess lover. But then I have to return to my place under the stairs, feeling trapped. But I sense permanent freedom is coming.
And going to the next page, do you recognize that message?
Yes, I do.
And could you indicate the date that was sent, to whom it was sent, and by whom, and read the text into the record?
Yes, so on 7/30 or July 30th, 2019, Chad sent Lori an SMS message that read, I got the inspiration to go back to my original death percentages that helped us track Charles, Ned, etc. Tammy is very close. Her percentage has fallen steadily since Hiplos left. It is encouraging.
And we see in there the mention of Ned, who you've already indicated you were able to determine who that was. Does that additional name Iplos or Hiplos, were you able to determine who that references to?
Yes, I was.
And who was that?
That was one of the first names that was associated with an evil or dark spirit associated with Charles Vallow, was Hiplos.
Did you also locate messages between Alex and Lori on that device?
Yes, I did.
And do you recognize the messages on that screen or the page in front of you?
Yes.
Could you indicate who sent those, to whom they were sent, the date, and read the content into the record?
On September 3rd, 2019 at 10:02 a.m., Alex sent Lori a message. Network name is anti-layman. Password is the number 2, too many kids. Lori responded to Alex, funny.
And this was sent on September 3rd of 2019.
Yes.
To the best of your knowledge, were Tylee and JJ missing at that point?
Yes, they were.
On September 3rd, were they missing?
September 3rd. I'm not sure the exact date on when we started looking for them. I'm not sure
You became involved in the investigation a little later?
Yes.
Would it have surprised you to learn that they were last seen later in September, Tylee on September 9th and JJ on September 22nd?
And I'm object to the form of the question. I believe that, well, I'll just withdraw it. Okay.
I'm not sure the exact day that they went missing in this case, but like I said, I did pick up this investigation later on in January.
And you had indicated you were aware of the attempted shooting of Brandon at the time you were looking at these accounts.
Yes.
Do you know the date of the attempted shooting of Brandon Boudreaux?
I believe it's October 2019.
Do you recall locating any searches or deleted searches on either of these accounts?
I do.
And were they around the time of the shooting of the attempted shooting of Brandon Boudreaux?
Yes, they were.
Do you recall what they were searches for?
So on that day, there was some deleted cookies on her account, and a majority of those searches were for news stations in Arizona.
And were those deleted cookies from October 2nd of 2019?
That sounds about right, yes.
As part of your investigation, did you also review phone data from an individual named Zulema Pastenis's phone?
Yes, I did.
Did you locate messages on that phone?
I did.
And I believe you've already indicated that you also looked at an iCloud account associated with Charles Vallow?
Yes, I did.
Your Honor, I would ask to have the witness shown what's marked as State's Exhibit 51. I believe the court and counsel should have a copy. And to keep the record clear on that last Exhibit 48, we will mark the jump drive with an exhibit sticker and submit it to the court as well.
All right. Thank you, Ms. Blake.
And can the witness be shown that exhibit?
Yes.
And if you would look through those pages.
Cesar Millan's #1 dog longevity tip.
You want your dog to live the longest time? The biggest thing you can do for your dog's longevity is to make sure.
Okay.
And do you recognize those?
I do.
And are those in fact messages that you located during your search of Zulema Pastenis's phone and Charles Vallow's iCloud account?
That is correct.
And did you go over that exhibit with the state?
I did, yes.
And did you do that in preparation for your testimony here today?
Yes, I did.
Did you assist in creating those pages?
Yes.
And would it be helpful in your testimony today?
Yes, it would.
Your Honor, with that, I would ask that the exhibit be admitted.
Any objection to admission of Exhibit 51?
No, we would like to put on the record that we have objected to this particular exhibit and all the information contained therein under 404B, and we understand that our objection was overruled in February.
All right, thank you, Mr. Thomas. So the court has previously made a ruling under the 404B rule that this evidence is admissible for purposes of trial. The exhibit, then, without further objection from the defense, Exhibit 51 is admitted.
Your Honor, I would ask to be allowed to publish Exhibit 51.
You can publish it.
And again, for the record, this is similar to the last exhibits where there is a paper copy that has been provided for the court and counsel's convenience. We do have a jump drive with the PowerPoint on, which we will intend to mark with an exhibit sticker and admit.
Okay, so that jump drive and digital file will be the actual exhibit, and counsel and the witness may refer to the paper copy so long as it conforms with that digital file.
Detective, do you recognize the messages on the screen or on the paper in front of you?
I do.
And do you recall if those were located from a phone extraction on a device belonging to Selema Pastenis?
Yes, they are.
Could you could you indicate who sent the message, who received it, the date, and then read the content of the message into the record?
Yes, the first message from Lori Vallow to Zelema Pastenis, dated May 29th, 2019 at 10:32 a.m. Perfect. I found out there are 4. One is a level 4 entity. His name is Hiplos. The H is silent. The other 3 are level 3s. Let's do this. Message from Lori Vallow to Zelema Pastenis on June 2nd, 2019 at 11:54 a.m. Yes, it does. Let's put some fire energy towards Hiplos now. He is driving now, and today is the day. I can do it spiritually. Let's go to him and hover over the truck till we do it. Are you ready?
And again, and Judge, can we take a brief recess?
Yes.
Could you indicate who the sender was, the receiver, the date, and read the content into the record?
Yes, the message from Zelema Pastenis to Lori Vallow, July 2nd, 2019 at 7:52 p.m. Also, I was given instructions today to rip, tear, or burn the aura of Hiplos to let the body energy out so he can't re-enter. The next message is from Chad Daybell to Zelema Pastenis on July 2nd, 2019 at 8:35 p.m. I am very happy to find out these estates. You and Lolo have doing amazing work. Mother Earth is so grateful to you both. Thank you as well for your help with Hiplos. He is so very close. Chad Daybell message to Zelema Pastenis, July 13th, 2019 at 9:57 a.m. Hi, Zelema. Yes, I would be happy to give you a blessing, possibly this evening or tomorrow. It is crazy about Charles, but such a relief.
In that second message, through your review of accounts and phone records, were you able to determine who Lolo would be referring to?
Yes, I was.
And who was that?
Lolo was a nickname for Lori Vallow.
And that last message was sent on July 13th of 2019?
Yes, it was.
And Charles would have already passed away at that point?
That is correct.
Do you recognize the messages on the next slide?
I do.
And could you indicate who they were sent from, to whom, the date, and read them into the record?
Yeah, the following messages were between Lori Vallow and Zelema Pastenis on June 2nd, 2019. The messages range from 11:55 a.m. to 12:42 p.m., and they read as follows. Zelema to Lori. I'm ready. Lori to Zelema. Let's go now. Zelema to Lori. That is powerful. I'm still sending fire. Lori to Zelema. Yes, it is. I am blinding him with light. Zelema to Lori. Oh, that's awesome. Lori to Zelema. I'm feeling it big time. Raphael is with us. Zelema to Lori. I feel him. Lori to Zelema. Did he leave? Zelema to Lori. I can't see him. I felt like I was chasing him because I saw me running after someone. Lori to Zelema. Get him. Zelema to Lori. Oh, I'm chasing. Lori to Zelema. You are amazing, lady. I love you. Zelema to Lori. I'm tired now. LOL. Lori to Zelema. Me too. I'll keep the light, abs, fire, gong till he's gone. Zelema to Lori. Me too. I'm still sending it.
And with these messages that we've gone over today, including this one, are there sometimes emojis attached to those messages?
Yes, they are.
And these slides did not contain the emojis that were present in the originals, is that correct?
That is correct.
We talked previously about the email account kkwalker75@yahoo.com. Did you locate additional messages linked to that email?
I did, yes.
And do you recognize the message on the next slide?
Yes, I do.
Can you read that into the record?
Message was sent April 21st, 2019 at 6:20. Dear Brother Daybell, hi, this is Karen from Vallow. I contacted you a couple weeks ago to see if you would be willing to come speak to our youth here in Houston, Texas. You said you probably could if there was a way to cover your expenses. Since then, I can't shake the feeling that you need to come share your story, particularly about chasing paradise. We are near the Houston Temple, and this summer our stake is focusing on family history work. My reason for contacting you again is that we have a stake youth conference planned for all day on Saturday, April 27th. The focus is on the temple, and I know you would energize the kids with your stories. We expect about 400 kids to attend, including some parents. I know it is extremely short notice, but is there any chance you could come? A high councilman is currently the main speaker, but he said he would be happy to let you speak instead. My husband and I have been financially blessed, and we would pay for your flight. We also have a casita attached to our house where you could stay and not be bothered. Also, my daughter mentioned the young single adults would love to put together a fireside on Sunday evening. I realize your main goal is to sell books, and that wouldn't be possible at these events, but I know that the interest in your novels would skyrocket here. I'm sorry it's so late. If possible, please let me know as early as possible in the morning so we can include it in the Sunday announcements. Also, we'd want to get your flights booked. If you are able to do both events, we could fly you in Friday, then depart on Monday. Please let me know if this is possible. We would love it. Karen Walker.
And did Chad respond to that email?
He did.
And on the following slide, do you recognize that, the content of that slide?
Yes, I do.
And could you indicate who that was from and read the content into the record?
The response to that previous email that I read reads, "Hello, Karen. Yes, I will be able to come. So let the wards know. I can talk to you later about arranging the flight. Chad."
Do you know where Lori Vallow was living on April 21st of 2019?
Lori was in Houston, Texas.
When you did your review of these messages, or of these devices and these accounts, did you pass your findings on to other law enforcement?
I did, yes.
Did you share the phone extractions with other law enforcement?
I did, yes.
If I can have just a moment. The state has no further questions.
Make your dog a Quattro dog.
All right, so there is an update from the courtroom. Hold on. There has been another juror that has been excused. I don't know why. Also, hold on a minute. Another juror during break was on his cell phone with his daughter. So now they're going to have to, so they're down, how many? They only have 2 alternates left. They're bumming. They are bumming. Hold on a minute. And Chad is nasty. He's so icky. Icky. I mean, look at Charles. Look at Chad. Come on. That's a no-brainer. Just saying. Who wants somebody that writes these fantasy books, right? Let's be with a man that's a man, a real man, right? A baseball player, right? Has a career, professional career. Come on now. Come on now. So let me look through here. Didn't you just move? Didn't you just move? That's scary. I know, right? Look at Chad. I'm sorry. Okay? But come on. He doesn't even have a personality, all right? You can look at him and see nothing but a frog. Okay? Hold on a minute. Let me bring something up. Let me bring something up. No, not yet. So look at this ding dong here, Chad. The other house isn't done yet? Oh. Jeremiah was a bullfrog. Here she is. This is the first time you ever seen this demon smile. Yeah, let's smile for my death row picture. Yeah. Yeah. I hope he's having fun in his little tiny cell to himself. Yes. Kermit the Frog. All right, so any minute now we should be able to come in the courtroom. Uh-oh. What's going on here? What's going on here? Only the video feed is on a 30-minute delay. Okay, 30 minutes is up. I say 30 minutes is up.
Super soft bras made for seniors by a 70-year-old woman. Soft wide straps. Easy front.
You know, if that prosecutor would have let Lori, if that prosecutor would have let Lori continue asking that man all those questions like that, right? Because we all know for 45 to 50 minutes, Alex did not call for help. So by the time help came, it already probably been an hour and a half, hour and 45 minutes since he passed. But no, it's got to be tit for tat. Tit for tat.
Judge, we do need to raise one issue. I was advised that juror, I believe 15, was looking at his cell phone during the testimony of the previous witness. I don't know if it was coincidence, but right after that, he put a question into the question box. We did have a very detailed medical questions for Captain Keller.
Is that the gentleman with the white hair and the glasses?
Yeah.
Okay.
So I wanted to see if we could ensure that there isn't any additional
All right.
investigation going on.
Let's bring juror 15 in.
All right, here we go. We don't get to, okay, so I got it a little wrong. The juror was on the phone during testimony. What is going on?
Expert or non-expert?
Are you calling him next?
Yes, Your Honor.
Okay, I last week on Monday asked you if you were objecting to him as an expert as much as late disclosure, and your at that time was that it was late disclosure, that the case had been pending for 4 or 5 years, and that you felt that his disclosure a month approximately before trial was late. I then said I would go back and look at the state's 15.1 supplemental disclosure statement about his testimony. And it appears from the avowal made in that statement that he has relevant information that could assist the jury in making a determination. Do you want to be heard on that?
Yes.
Go ahead.
I feel like it was the state just putting him on as an expert so that he can give his opinion. I wasn't objecting to him as a detective and someone who's been there on the case, or as the scene agent, but he went from scene agent to expert so that he can give his opinion. And I don't think it is relevant that he can give his opinion at this time. We weren't allowed to have enough time to get someone to rebut his professional opinion.
Based on his training and experience, he was going to make an opinion about one of the gunshots being fired, possibly from the victim laying in a prone position.
As a firearms expert, and we haven't had a CV on how he's a firearms expert.
There was information on his training and experience contained within that 15.1 statement. I think additionally, questions about whether or not the extent of his training, the extent of his experience would probably go more toward the weight that the jury should give it rather than the credibility. I should say, rather than the admissibility of it. You're free to cross-examine him on his training experience or lack thereof. But at this time, I was inclined to allow him to testify. I'm hesitant to use the term as a full expert, but he has training and experience that could assist the jury in making a determination one way or the other based on that. So,
And he can't do that just as the scene expert or as the detective that was there?
well, I think he could, based on his training and experience, do that. I'm hesitant to call him an expert per se in the sense of a scientific type expert with scientific type testing, which requires more foundational evidence on someone's expertise. This type of testimony, I think, is testimony that a lot of people that have experience with guns could have an opinion on. Again, you can cross-examine him on his knowledge, his training, his experience, etc.
But will it be given to the jury that he is an expert in firearms? Yes or no?
I don't know. I guess I'll have to see how the testimony, what kind of foundation is laid for that by the state. All right. Anything the state want to supplement your argument or your 15.1 motion?
Your Honor, no. The defense was able to interview Dan Coons on March 21st of 2025. So after that was noticed, so they were given the opportunity to question him regarding any of his expertise or not. And really the state filed that in an abundance of caution. I think that a normal scene agent with sufficient information and knowledge and training might be able to discuss trajectory, but we wanted to make it clear that he did have that sufficient background, training, and expertise to do that.
Are you planning on eliciting testimony that an opinion as to which shot was first as opposed to which shot was second?
Only in that he did attend the autopsy, so he does also understand both that information, the shored wound, which goes into play in his determination of the trajectory, as well as that the other shot went through the victim's heart. So I think he can say that what he believes the trajectory for each shot is. I guess if someone wants to argue that he was shot in the heart first, or laying on the ground first and then got up and was shot a second time through the heart, I don't think that he has that expertise to say that perhaps someone couldn't do that.
Well, I think the point I'm getting at is no one observed it that is going to testify to the shooting as far as I know so far. And that I don't even think your medical expert could definitively say this was shot 1 and this was shot 2. So that's fair cross-examination. But other than that, I'm going to allow his testimony. If you have a foundational objection or any other sort of hearsay objection or evidentiary objection, you can make it depending on what the question is.
Okay. I don't really understand how the trajectory is relevant to conspiracy, so I would like to make that objection. We're stipulating that there was 2 shots.
Okay.
Your Honor, just for the record, it's because the defense has noticed self-defense.
Right. All right. Let's bring the jury in. Yeah, why don't you do that? Hey, I was meant to ask Treya to move that. Hey, will you move this podium back? Because we're not going to need it until closing argument. Move this back over there before we bring it.
Let me go get it.
All right, sir, come on up. You're going to stand right here and be sworn in.
Do solemnly swear that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God.
All right, so sir, go ahead and come around here, have a seat to my left.
Sir, would you please introduce yourself to the jury?
My name is Daniel Coons.
And where do you work now?
Well, I am part-time temporary employed with the City of Chandler Police Department as a civilian criminal investigator for cold cases.
Where did you work before that?
Before that, I worked I finished working as a detective with the Chandler Police Department. Specifically, the last assignment was robbery homicide unit.
How long did you work for the Chandler Police Department?
Just over 30 years.
Can you walk us through your different assignments at Chandler Police Department?
Sure. After my basic training at the academy, I was assigned to patrol. I did that for a little bit. And while I was in patrol, I was assigned as a crime scene officer. Now that's still a patrol officer, but it's additional duties such as collecting evidence, processing crime scenes, taking photographs, things along those lines. After I did that, I went to crime prevention for a couple years. I did that and came back to patrol, found a calling to go into detectives. I became a family crimes detective for 5 years. And from there, I became a homicide detective. During that time, I was also assigned part-time. We don't have a full-time SWAT team, so I was on that for just about 20 years.
Can you talk to us a little bit about your training to become a SWAT officer and what a SWAT officer does?
So there are many jobs within SWAT. There's regular officers that typically will do entry. There's some that do, specialize in breaching, some specialize in grenadiers, and then we also have the snipers. So I was cross-trained to do the regular basic entry officer stuff, as well as I became a sniper, and eventually I became a sniper instructor.
Okay, so what kind of training did you have to go through to become a sniper and sniper instructor?
So the sniper training was a basic 40-hour course. I attended that with the FBI. And as time progressed, I would attend advanced sniper trainings so that I could enhance my skill set. And eventually, after having been on as a sniper for a while, I attended a 40-hour sniper instructor course.
Who is that with?
That was with the American Sniper Association.
As a trainer for snipers, what did that entail?
It entailed having to have a good working knowledge of the actual job, the ballistics that the rifles need to perform, knowing how to train new snipers, knowing how to keep snipers that have achieved certification to keep their skill sets up, and to keep meeting the mandates of what would be expected of a police sniper.
Did you ever become a shooting reconstruction expert?
I did.
Can you tell us what does that mean?
It means that I attended a course. It was a 40-hour course where it was completely hands-on. There was classroom, a lot of hands-on with you not only see the results of different impacts and things like that, but you watch it happen. And then in some cases, you actually get to make it happen. And then after that, you, as a class, you work together, putting things back together. And at the end of the 40 weeks, there is a test that you have to pass to get certification.
You said 40 weeks?
Or sorry, 40 hours, sorry.
So what does, I guess, shooting reconstruction mean, if you had to explain that to us?
It means being able to take information from a scene and being able to put it together to reconstruct as best as possible or humanly possible what happened. For instance, you have bullet strikes. In some cases, you can actually get a good angle or ballistics information so that you can backtrack it and get an approximate area where the shooter had to have been. In many cases, you can help articulate whether information given to you was factual or if the information given to you was not. And this is very handy when there are no witnesses and you only have basically the person saying what happened.
Is there any type of certification process to be a shooting reconstruction expert?
Yes, at the end of that course, I had to successfully complete a test in order to get certification.
And when did that occur?
That was in, I believe, early 2017.
Who is that through? Who puts that on?
It was with Michael Haig,
And
his
who is-
company.
Who is Michael Haig?
He is part of a duo, father-son duo, that have become quite renowned for their ability to do ballistics and then teach it and train other people with it.
And have you utilized those skills that you learned in that shooting reconstruction course as a detective since then?
Yes, many times.
I assume you passed the certification test?
I did.
So on July 11th of 2019, were you working as a detective at that time for the homicide unit at the Chandler Police Department?
Yes, I was.
During the weekdays, what were your, I guess, work hours normally?
My normal work hours were Monday through Thursday, about 7 to 5.
When you are working as a detective, we've heard a patrol is out driving around. What are you guys doing?
Well, we carry a caseload. So many times we are working on the cases that we've taken previous days or weeks ahead of time. We're trying to come to a conclusion for those particular cases. But many times we also will have our radios on, just kind of listening to what's going on.
So are you at your office is at the main police station?
Correct.
Okay. On July 11th of 2019, did you hear some police radio traffic of a shooting at 5531 South Four Peaks Place?
Yes, I did.
Did you respond to the scene?
After collecting some equipment and putting it in my vehicle, yes.
Is that normal then for detectives with homicide to go out to the scenes?
For the unit at the time, yes, it was.
Can you describe for us what the scene looked like when you arrived?
There were police vehicles around. There were officers that had established a perimeter. Some crime scene tape was already put in place. And they basically had frozen the scene.
Do you recall about how far away this scene was from the station where you were located?
15, 20-minute drive.
When you arrived there, were other detectives arriving? How does that work?
There were several of us that had self-deployed, and we were in various stages of being on our way there. So other detectives did arrive.
How do you decide which detective is going to do what at a scene when you all just show up there?
Well, a lot of times it's just a matter of who speaks up first saying, I'm going to take case. If it's after hours, then the person that's on call will usually be the person to do it. But if it's during regular business hours, it's kind of like a little wrestling match to figure out who's going to end up taking it.
What role did you get?
I got assigned the scene.
Okay. What does that mean to be assigned scene?
So the scene work, assigned scene means that you're responsible for making sure that the scene is processed properly, accumulate whatever evidence is necessary, report back to the actual case agent your findings so that they can stay aware of how things are transitioning and being learned, and then they can start making informed decisions on what the next step is going to be.
Do you do that alone or do you have help?
It depends on the scene. In this particular case, I had Detective Duncan along with me.
And do you have any, does Chandler Police Department have any like crime scene specialists or people that come up to help as well?
Yes, when I left the crime scene officer program, they had actually started a civilian program so that they could free up the officer's responsibility. So Chandler has several crime scene techs that will respond out when called.
And was someone called out to that scene?
Yes.
Do you sort of, as the scene agent, help, I guess, tell them what to do? Are you the person who's overseeing the whole scene?
It's more of a collaborative effort. We do provide direction on things that we're specifically interested in, but I've worked with them for many years, so it's pretty easy for us to just understand, all right, some of the basics that have to be done, such as overall photographs. Before we even think about manipulating anything or marking anything, we want to try to capture the scene as it was that we walked into it.
As the scene agent, did you create a diagram to just reflect what the scene looked like?
Yes.
And is that to scale?
It's not to scale. It's close, but it's not to scale.
Your Honor, if I can have my paralegal approach with Exhibit 5. And I think there's a second page in there.
It is behind, but it's not exposed to the back. Yes.
And is that the sketch and then the second page measurements of that diagram that you made?
Yes.
Your Honor, the state will move to admit Exhibit 5.
Any objection?
If it's not to scale, I don't know how it will be helpful, but no objection.
All right, Exhibit 5 is admitted.
And if I may publish.
Go ahead.
That's not lit up. Well, we might use the one behind you.
Right.
All right. Can I have the detective? Oh, never mind. There you go. Okay, so this is Exhibit 5, the first page. Is this sort of an overview of the entire residence as well as the items of evidence that you collected?
That is correct.
So we understand where we see these little yellow placards. What do those indicate on your diagram?
On this diagram, they indicate the items of evidence for that particular room.
Okay. And do they each have a number associated with them?
Yes.
And is the second page of your diagram a reflection of what each of those numbers refers to?
Yes, it is.
We see in this A, B, and distances. What is that?
So the reference points, for this particular purpose, we did a triangulation method. So we take measurements from 2 known points in that room, and then we measure out to the item of interest. And then that was how we get a point A and a point B measurement.
All right, so at the first page here, that's the actual diagram. What is the reference points that you are using to make these distance measurements?
So the reference points are not depicted on this diagram, but in this particular room, if you look at the wall where items number 2 and 12 are, the upper or the left upper corner is B, and if you go straight down towards the kitchen area, that along that wall, that corner is A.
Okay, so when we see a reference measurement from A of 21 feet to the bat, we're talking 21 feet this way should be where the bat was?
No, you're talking 21 feet from that corner, straight line to the bat.
Okay. So whatever the closest measurement or closest way to get there would be?
Correct.
So the bat, it would be something like that.
Correct.
Okay. And then when we see reference point B for the bat, then you're talking from this point to the bat?
Correct.
Okay, just so we understand that. When Chandler Police Department goes to a scene like this, do they utilize any type of photography system to help better document a scene so that you can see things more clearly sometimes than with photographs alone?
Yes, depending on the scene, we would use a system called the Lizard Q.
What is Lizard Q?
It's, in essence, a 360-degree photographic system that you set up on a tripod inside or wherever your location is, inside, outside. And you start the process, and the internal computer for this system specifically takes a set number of pictures where it's overexposed all the way to underexposed, and the images in between. And it does this at various locations along the path to create enough overlapping images. And then those images are stitched together and actually create a 360-degree sphere of the scene.
Did you have to get trained on how to use Lizard Q?
There was some training involved, yes.
If, again, my paralegal can approach with Exhibit 139, you can take a look at that. Do you recognize a thumb drive that is in Exhibit 139?
Yes.
What is on that thumb drive?
On this thumb drive will be the Lizard Q spheres.
And is there a reader on there so that you can actually view it?
Correct.
There's a piece of paper in there as well. What is that?
The piece of paper is a set of instructions on how to use the Lizard Q viewer so that you can view the spheres.
And did you initial the thumb drive to indicate that you had viewed it and you recognize that as the Lizard Q that you created on July 11th of 2019?
I have.
Or did you actually create that?
I created the thumb drive.
And that's your thumb drive that you put it onto?
Yes.
All right. State will move to admit Exhibit 139.
Any objection?
No objection, Your Honor.
139 submitted.
Judge, at this point, might I ask the witness to come down here to utilize the Lizard Q? I can sit at the table, but it needs to be put into a computer to do that, and I don't think we can hook it up there. All right, so if you can insert that That laptop in there. Yeah, thank you. I'm sure I might have to log in. I just might have to log into my computer, sorry. Oh, nope, still like. I'll let you from there. All right. Can you talk us through, so you've opened the thumb drive to where that's at. How do you get to viewing this program?
So first, you'll have to double click on
Hold on, one sec, I'm sorry, we're waiting for it to. Yes, the USB is in that laptop up there on the podium. There, yeah.
So first you need to double click on the lizardqviewer.exe so it can open it up. And then it's going to ask you where to look for the spheres. That's going to be and then you just double click on the sphere you choose to open up, and it will open it up for you.
Can you make that larger so we can?
Waiting for it to respond.
Got it. Okay.
So once you have the sphere open, you want me to just?
Yeah, if you can just tell us how to work that first, and then we'll ask a few questions.
So once you have the sphere open, if you depress the left mouse button, you can actually move the images around. Without depressing the mouse button, you can zoom in and you can zoom out with the scrolling wheel. If you depress the right mouse button and use the scrolling wheel, this will darken or lighten your sphere. It will give you the ability to look outside as opposed to just the photographs washing it out normally so you can see inside. With this particular program, you can open up multiple windows, but you'll really only be able to view one at a time, but you can go back and forth between them.
So for this sphere that we're looking at, we see Charles Vallow there, correct?
Yes.
And then there's some white cards that we see around the room. What are those?
Those are 3x5 cards that officers have dropped in the scene. A lot of times they'll do that to help identify to detectives items that they observed and to be a warning to other officers to watch out for these items as you're either moving through or exiting the scene.
Is the Lizard Q program then used prior to the scene being documented? And well, let me say this. We saw in your diagram, Exhibit 5, that there were little yellow placards or numbered items. Is that something that's actually done in the scene? So we were looking at the bat, for instance.
Correct. So in this particular moment in time, we just merely left it with the placards there. Again, it was attempting to capture the scene as we as an investigative unit found it. There can be times that we'll do this first and eventually go through putting evidence placards down and then maybe do another sphere showing all the evidence placards.
So would it be fair to say that this is done to document the scene prior to police going through and having, maybe digging through areas to find potential evidence?
Right. It's much like when we do overall photographs with the 35mm camera. This is just another enhancement of that.
For this room where we see Mr. Vallow, do we have two different spheres?
Yes, in this particular room, I did a lower sphere and then I raised it on the tripod that you can see in it to another height. And then I did a sphere there. So we have a program that we can combine those and make it a measurement sphere. So we could do measurements linear, but not to and from the camera because of its limitations.
So what is provided here is without measurements.
That is correct.
And without anything being marked yet.
Aside from the 3x5 parts.
Can you show us the lower level sphere as well?
This is the lower level.
Okay, then the upper level one, sorry.
As you can see, your point of view has changed a little bit, but the room has remained the same.
Okay. And that's all using the same initial placement of that tripod, but just moving the camera height up higher or lower?
Correct. The tripod has the ability to elevate to the platform that the camera is actually on.
All right, thank you. Connor, could I have the witness go back to the?
Yes.
Thank you. I'm gonna turn this for now. So although that documents what the scene looked like that we saw prior to the marking of evidence, as a scene agent, do you still utilize photographs?
100%, yes.
Why?
It's just an added fail-safe. The lizard queue can, if you do the lizard queue, then you're restricted to just the view from where that camera is at. When we do overall photography, we actually move around and get it from different perspectives. This is just another tool in the ability to show what the scene looked like.
Did you also photograph rooms where the lizard queue was not used?
Yes.
When you photograph a scene, what is the process for that?
I'm not sure I understand.
Sure. When you enter a scene as a scene agent and you are looking at one like this, do you just go into the room where this person is and just photograph that area and that's it?
No, we would photograph the entire place to document it. The lizard queue, because of the volume that it takes and not necessarily information that would require the setup of a sphere, then we will just stick with the crime scene photos for those particular rooms.
Okay. So I can have my paralegal approach with exhibits 6 through 138. You can look at those and let me know if you recognize what those photographs are.
What is this guy looking for? Or what is he looking at? I know he's reading something. Maybe his report. I don't know.
Do you recognize all those photos?
Yes, I do.
Do they accurately depict 5531 South Four Peaks Place, both before and during and after processing it?
Yes, through various stages of the investigation.
Your Honor, if I can have those shown to the defendant.
Yeah.
Now, Detective, when you guys are processing a scene, in addition to photographing it, are you also looking for items that you may want to collect and actually bring back with you?
That's correct.
Can you talk to us about what procedures you use to collect and impound physical items of evidence that you're going to take with you?
Sure. It depends on the type of physical evidence, what the circumstances of the offense are. So the type of collection method can vary, but inevitably we'll identify it first, then we'll document it with photographs, and then we will come up with the plan that we're going to recover the evidence. And typically on scenes, I like to work in a particular direction collecting evidence. Others have their own method, but that's the method I typically use. And then I work along with the crime scene tech, and we'll go through exactly what we talked about. We'll have the overall pictures taken. We identify things that we believe are going to be relevant. And then we'll, for identification purposes, we'll usually affix some form of evidence tag, a marker, things along those lines. Not all items are actually taken. Some are actually just documented because it's impractical to remove certain things, such as a slab of concrete or something like that. So depending on the situation. So after it's documented, first with photograph, placard, photographed again, and then we will collect it. If DNA is an issue, the crime scene tech will be the one that'll take care of the method for doing it, and they will take the protective measures, whether they do gloves, swapping gloves out, or they do face masks, depending upon the nature of the evidence. If it's super DNA critical, then we will pull all the precautions out. In this particular case, it was not DNA critical.
Do you still wear like gloves or anything like that when you are collecting these items of evidence?
Absolutely.
And are you using them and changing them to ensure, for instance, you don't transfer blood from one item onto another?
Right, and typically that's what our crime scene techs will do. We will direct the method or the order we're going to collect, and then we'll go through that. And they'll be the ones that'll photograph. They'll change the gloves, place it in the envelope. Typically it's a paper envelope. And then we'll move on to the next item and repeat the method.
So in this case, I'll put 5 back up if I can have the Alamo. Thank you. What was your process for how you wanted to go through this home in reviewing, collecting the evidence?
So for this particular method, I chose to work from the north towards the south, collecting as we went. Item 1 being the hat, which is at the north end of the room. And then it was kind of a toss up between 2 and 3. So I just decided to go ahead and go for 2, and then we would work our way down from there.
Okay. And so we see in this diagram, north is up this direction.
It's to the left of the image, yes.
Okay. And so in the photographs that you're taking of these individual items, do you see those placards or something that shows a 1?
Yes.
Now you talk about in this that there are scenes where you may have difficulty collecting an item. In this scene, did you actually cut out some pieces of evidence to bring back with you?
Yes, and that's why you'll see numbers higher than what was originally in the room associated to those items.
When you are processing a scene, do you always know what may be relevant or not relevant?
Not always immediately.
Is that one of the reasons why the entire residence is photographed instead of just what appears to be relevant here in that one room?
Correct.
So that later, if anyone wants to look at another room, that's been documented adequately.
Right.
When you're going through a house, even though you walk in and you see Charles Vallow on the ground there, are you still checking all of the rooms to see if there could potentially be something of evidence there?
Well, certainly. I'm no stranger to not having all of the information initially when I show up. So I will go through and I'll look at the residence to see if there's anything that actually stands out immediately. And maybe I'll be able to ask a few questions of whoever's doing the interviews to see if there's any relevance to it.
So are you looking for instance, any bloody items?
That would be important.
Are you looking for any projectiles or anything else that might be not in this room?
Certainly. Bullets pass through walls.
Are you looking for any evidence that might be related to this individual, Charles Vallow, like wallets or things like that that might have been left somewhere in the house?
Yeah, anything that could properly identify who was or may have been present at the time.
And that's sort of all those photographs as well.
Correct.
When you photograph a scene, do you start at the outside of the home?
Yes, we will typically start at the outside and work our way in and carefully avoid the items of evidence that have been readily made identifiable.
So Exhibit 6 here, what are we seeing here?
So this would be the front of the residence. It faces west. And we're looking at the main entrance that's just off to the right of the closed single garage door, and that door is open.
Your Honor, we're going to have to object. We haven't agreed to admit any of these pictures that are being posted.
I'm sorry, I did show them. The state will move to admit exhibits, 6 through 38, or 138.
Any objection?
To some of them, I mean, they're very similar, and I don't think that they all need to be put on there.
So your objection is that some of them are cumulative?
Yes. Yes, Your
Right.
Honor.
Let me see them. What numbers?
Yeah, which number, sorry?
6 through what?
138.
Do you have specific ones that you believe are cumulative?
Yeah, I'd have to go back through to get them specifically. I have some.
Well, let me browse them.
You have got to be kidding me. This is nothing but a waste of time. I'm going to see how long this prosecutor's been doing this. Hold on.
All right. Well, I've reviewed exhibits 6 through 138. While many of the exhibits show multiple pictures of the same items, there's no two pictures that are the same. They show different angles, different distances, different perspectives, and in some cases, the item as it was found, as opposed to someone picking it up and showing it from a different angle. So they're somewhat cumulative, but the court will admit those exhibits. They may help assist the jury in visualizing the scene and determining where things were at the scene.
So we had talked about Exhibit 6 being the front of the house. The door that you were talking about there, is that the door we saw in the lizard queue that was in that front room?
Yes, that's the double front main door.
Exhibit 7 and 8, was that to document a vehicle that was there?
Yes, again, to try to do overalls of the scene to show how it was when we got there.
At that time, did you know whose vehicle that was?
I did not have the opportunity, nor did I run the license plate of it, but it was documented, and I believe later on it was learned.
Okay, thank you. But not something you were responsible for?
Correct.
When we get to Exhibit 9 and then 10, is this sort of coming up to, and I'm going to pull this back a little.
Yes, that's approaching closer to the door.
11, which way are we looking as we enter the door here on 11?
So you would be looking to the northeast, northeast.
And you had talked about in a diagram a hat. Is that sort of what we see here?
Correct.
Okay. Is Exhibit 12 sort of looking the opposite way from that sort of vantage point?
Correct.
Or south?
Southeast, yeah.
And does Exhibit 13 show us what the front entryway looks like?
Correct. So this image would have been taken from the northeast corner of the main room there.
We can see in this then the hat with the placard of 1.
Correct.
So when we are looking at your diagram, Exhibit 5, and we see the 1, that's what that's referring to.
Correct.
Exhibit 14, can you tell us our perspective of what we're looking at here?
So you're standing in roughly the northwest corner of the room, just down from the entryway, and you're looking south.
So we start to see some of those white cards there. Is this before you have added in the yellow placards?
Correct. This would have been part of the overall photographic effort.
So when we're looking at this house, I'm going to put up Exhibit 15. Can you describe for us this wall here? Sort of, can you go all the way around that?
So that wall with the mirror itself is blocking where the kitchen is. There's an entrance to the kitchen to the right of that wall. And again, you could get to the kitchen through the left opening as well, but I think there's also like a family room by that area.
But it's open. One could walk through either of these ways and come around back out the opposite door?
Yes.
Okay. So Exhibit 16, we see Charles as he lay when fire has left him at this point.
Correct.
So the items we see on him, we've heard of them cutting his shirt and things like that. This is you documenting how he was when you started to come into the scene.
Correct.
After fire's already treated him and determined he was deceased.
Yes.
Over here, we start to see an area. What is right over there?
So just past that most southern index card is a hallway that extends to a bathroom and I believe at least 2 bedrooms.
Looking sort of to the north, what is this hallway here?
So now we're just looking north past the entryway. You can see the hat in the right part of the image there, and that would lead up to the master bedroom garage.
When you are looking at a scene like this, where you have a shooter, are you wanting to document all the different views of the items and the victim where they lay in the scene?
Yes, it's important to establish where things were at when we found them.
Now, are you able to tell us, for instance, if a casing rolled or a bullet rolled as fire is there or initial officers coming through?
Having not been present to see it, I would not be able to tell you if any item happened to have been manipulated.
Does 19 show us part of that hallway that we're talking about to the bedrooms?
Yes, it does.
And then right next to it, would that be the sort of doorway into the kitchen?
Correct. That's past this mirror on the left would be where the wall rounds a little bit and leads to the kitchen.
So Exhibit 21 here, we see this hat. Why, in 22, that you marked as number 1, why do you collect something like that?
The indications to me, initial assessment was that there was some kind of a struggle that took place. And it was unknown at the time who the hat belonged to. So it was decided that this could be important.
Are you given more than one chance to go through a house and try to collect evidence, or is it sort of a one-time shot?
Usually it's a one-time shot.
So if you aren't sure if something is relevant, do you collect it?
Yes.
So that later, if you determine it is, you have it?
Correct.
And if you determine it's not, then no harm, no foul?
Well, I don't know about no foul, but yeah.
So in this case, did you know whose hat that was?
I did not.
Okay. I'm going to put up 15 first. In the diagram, we had seen a number over in this area. What was that?
The item should be marking the baseboard, and there is a bullet strike in the baseboard.
All right, I'm putting up 23 here, and then I'm going to put up 24. What are we looking at here?
So what you're looking at is the actual bullet strike where it peeled away a portion of the baseboard, but remained embedded in the baseboard.
So I'm going to put up, as we kind of go closer, 24, 25, 26. Did you eventually show in 27 that you guys pulled back some of that board to get to show what was embedded in there?
Correct. And at some point, we were needing to recover that projectile.
Okay. And so in 28, does this reflect, now you've kind of photographed what it looked like when you first saw it, and then as you peeled it back and the actual bullet or projectile that was removed from there?
Correct.
All right. And 29, show that bullet from a different angle?
Yes.
When you were looking at this, and I'm going to put 30 and 31, was there actually some sort of white paint transfer on part of that?
There's a little bit of transfer of material to the nose of the bullet, yes.
I can have my paralegal approach with 243 and 245, or sorry, 243 and 235. Detective, do you recognize what those are?
Yes, I do.
What are those?
This would be the section of baseboard that we removed from the wall, as well as the projectile that we had removed from the baseboard.
Okay, I'm going to put up 34 here. Does that show sort of after you pulled out that section of that baseboard?
Yes, after it was cut out.
Okay. And then it's the projectile that you recovered in there? From that location, the other exhibit?
The other exhibit is the projectile that was recovered from there, yes.
State will move to admit 243 and 235.
Any objection?
No objection, Your Honor.
You said 243 and 245?
35.
Oh.
243 and 235.
It's ordered admitting 243 and 235.
If I can have my paralegal go retrieve that. So let me put up, to give us again a different perspective, 17 here. We've talked about, as you're kind of working your way down, you told us you started with the hat, then you went over to the baseboard, and then you went back to the west wall.
Yes.
And so we see in this photograph, Exhibit 17, what you have marked as item 3. What was that?
That was the baseball bat.
I'm going to show Exhibit 35. Is that a closer up of that bat?
Yes, it is.
Were photographs taken of the sort of edge of the bat itself?
The
The
fat edge, I guess.
The fat edge.
Here,
It's
I don't
called
know
bat.
nomenclature of the bat, so yeah,
Not the handle. How's that?
yes.
When you were looking at this, were you looking for any blood? And I'm going to put up 37, 38, 39, or any biological material?
We were looking for visible evidence, yes.
Did you observe any yourself?
I did not.
Did the edge look pristine and clean to you, visibly?
Visibly, I did not see any sort of biological evidence on it.
Did you note any biological evidence anywhere on the back that was visible to you?
I did not.
My paralegal can approach with 249. Do you recognize what 249 is?
Yes, I do.
And is that the bat that we have seen in these photos marked as item number 2, that we see here in Exhibit 35?
Yes.
State will move to admit 249, Your Honor.
Any objection? 248 and 249 are admitted.
So that was item number 3. I'm going to put up exhibit 40. Do we see a placard there for number 4?
Yes.
And what was item number 4? And I'm going to put up exhibit 42 here.
It is a full metal jacket projectile.
And in 43, does that show a different angle of that projectile?
Yes.
So this projectile was recovered to the east, maybe northeast of Charles Vallow.
Yes.
And was there any visible damage to this projectile?
There was some deformation to the projectile.
If I can have my paralegal approach with 239. Do you recognize 239?
Yes, I do.
And what is 239?
This would be what's identified in the picture as item number 4, the projectile that was found close to the body.
State will move to admit 239.
Objection.
No objection.
239 's admitted.
When you are photographing the scene, are you, again, we know this is after fire has been there.
Yes.
Were you present when fire was there?
I believe their engine was still there when I arrived on scene, but they were not inside.
So were you present when they were working on Mr. Vallow in the home?
No,
So do you know whether or not they had moved this projectile at all?
I do not.
When you were looking at Mr. Vallow himself, I'm going to put up 41, did you notice something on his left hand?
On the left hand, yes.
What did you notice on his left hand?
Substance consistent with apparent blood.
When you were looking at Mr. Vallow, did you note any other blood on his left arm?
I did not see any.
And when you are looking at Mr. Vallow, are you looking at the rest of his body to see if you noted any blood on his right arm?
Correct. I did not see any on the right arm. I did not manipulate the body until the medical examiner showed up.
So visibly, as he laid there in that supine position on the back with his arms out, what you were able to see, did you see any other blood like we observed on his left hand anywhere else?
On his chest, there was a little bit of blood, but on his extremities, I did not see any.
And so when we talk about his chest, is this the blood that we see here, sort of?
Above and below the pads.
Did the blood to Mr. Vallow's left hand stand out to you in any way?
Yes, it was interesting that it's just on that one particular part, but it's not completely surprising.
Was there any blood on the floor around where his hand was?
No.
So although we've heard of blood pooling underneath him, there was no blood around his hand as it laid there.
Correct.
So going back again to Exhibit 17, we've now talked about 1, 2, 3, and 4, correct? Do we see
Yes.
a placard number 5 there?
Yes.
What was placard number 5? And I'm going to put up Exhibit 45 now.
It was a shell casing.
And I'm going to put up 46 to be closer of it. And 47. Were you able to determine what caliber that was?
Yes, it belonged to a 45 automatic pistol.
Now, as a police officer, do you have a semi-automatic pistol yourself?
At least one.
Okay. And I guess as a reserve officer, do you still have some?
I'm not a reserve officer. I'm just retired. But yes, I still possess firearms.
All right. So in terms of a semi-automatic handgun and seeing this type of casing, can you tell us when you fire a gun, where does this come from? What is that?
So in this particular image, we are looking at what's commonly called a head stamp. That's going to be the opposite end of where the actual projectile would be inserted into the casing. The circular ring that you see in the head stamp there is actually what's called the primer, and that's what the firing pin hits to initiate the primer charge, which ignites the powder and then sends the projectile through the barrel.
So if I put up 48 here, we have a projectile that goes through the barrel. What is this item here? This casing.
So this is what's left of the cartridge. So it's the casing. This is what holds the powder charge. It holds the primer and it holds the projectile all in one unit until it's initiated with the firing pin striking the primer. After the charge starts the projectile down the barrel, then the most semi-automatic weapons will actually, the slide will start moving back to the rear, and there's a piece of the slide called an extractor that goes around that back rim of the projectile there, around the head stamp, and it pulls it backwards out of the chamber. And then it completes the cycle going all the way to the rear where it hits what's called an ejector, and that kicks the casing out of the gun and readies it to go forward, stripping a new cartridge off the magazine, if there is one, and loading that into the chamber ready for the next shot.
So when you fire the gun, projectile goes out the barrel and this casing gets kicked out.
Correct.
So I'm going to go back again to Exhibit 17 where we see 5. And I'm going to put up Exhibit 49. To the south of 5 here, did you find another casing?
Yes.
Is that what we see in Exhibit 49 and 50 as placard 6?
Yes, it is.
So were those located in the generally in the same location?
Fairly close to each other.
When a casing is ejected from a gun, do they just plop down and stay right where they landed?
No, there are many different types of firearms out there, so the casings can eject in different directions. Some will, or most will eject out to the right. Some will go farther back towards the right, some will go forward, some will go center, some actually kick higher up in the middle. It really depends on the manufacturer, the process, how the person's holding the firearm. So there are a lot of things about it, but there's usually sufficient energy designed in it so that it kicks the casing out so it doesn't interfere with the feeding of the next cartridge.
In your experience firing guns, can casings bounce or roll or move after they are ejected?
Yes.
Item that we see is number 6 and number 50 there. What caliber casing was that?
It's a little blurry.
Do you recall if it was the same 45 caliber as the other one?
They were both 45 caliber.
I can have approach with 238 and 240. Do you recognize 238 and 240?
Yes.
What are those?
These are the casings recovered from the main room where the body was.
What we saw as 5 and 6 in the exhibits?
That's correct.
State will move to admit 238 and 240.
Any objection to 248 and 240?
No objection.
248 and 240 are admitted.
238 and 240.
Oh, I'm sorry. 238 and 240? Okay, they're admitted.
Now, do the police move the body when you're processing the scene? Do you go around and move Mr. Vallow around?
No,
Do you have to wait for someone from the medical examiner's office to come do that?
that is correct.
Sort of the body is their responsibility?
Yes,
Are you present while they're doing that?
absolutely.
And are you looking for any other evidence that may be on, around, underneath Mr. Vallow?
Correct.
In this case, did the medical examiner's office come and remove Mr. Vallow's remains?
Yes, they did.
Once his remains were removed, did you document by photographing, we see here in 53, the blood that was left behind?
Yes, typically we would call this the void image to show what it looked like after the body has been removed.
Now, is the blood been moved somewhat by the body itself being moved?
Correct. Part of the process is the medical examiner's investigator will manipulate the body by rolling it from one side or the other to get a good look at the side that's not visible with how it was laying. And then they'll work on manipulating the body into the bag for transport.
So looking at the void or the blood pool that we see here, has it been altered somewhat from what we saw or observed while Mr. Vallow's body was there due to the movement of his remains?
That would be safe to say yes.
Okay. Did you and other officers clean up that blood pool?
Yes.
And in doing so, did you observe anything on the floor?
Yes. Underneath, well, once the blood was cleared off, we could actually see a defect in the wooden floor that was consistent with the projectile strike.
All right, I put up exhibit 56. There's a placard number 13 there. Is that far away so we can see the location of where that is in perspective to the room?
Yes.
Having seen Mr. Vallow's remains in the room and then having them removed, were you able to determine approximately where this defect that we see marked as 13 was located in relation to Mr. Vallow's body?
Yes, it would have been consistent with being under his left shoulder.
Did you take closer up photos of that defect?
Yes.
I'm going to put up 59 that shows that placard. Is this what you were talking about?
That is correct.
How did you, well, let me ask you this. Did you look at the rest of the floor to see if there were anything else that looked like that?
Yes, that was a consideration. So we did look at the rest of the floor.
So you went through that whole room to see if you found any similar type of defects on it?
Correct.
Did you?
No.
So this was the only one that looked like that?
Yes.
And I'm going to put up 58. So we see other defects in the ground. What made this different?
The size of it, the directionality, the fact that it was directly underneath the shoulder where we observed an exit wound, and the fact that there was a projectile found on the floor in proximity to this defect.
Was it, let me ask you this. As a person who has processed crime scenes, fired guns themselves, did it appear to you consistent with a bullet strike?
Yes, it did.
And what were you basing that on?
The way the indentation is and how it tapers up, coming away from the body in the same direction that the projectile was located.
Did you and other detectives remove that piece of wood?
Yes, with great pain, yes.
All right, putting up Exhibit 60. Is that to show the piece removed and Exhibit 61 to show the actual piece?
Correct.
And did you write on it so that you would be able to later look at that piece and know how that fit into the puzzle?
Yes, it was important to make sure to establish directionality on that piece.
If I can have my paralegal approach with 240. Paralegal approach with 244. Do you recognize 244?
I do.
And is that the actual piece of floor that was removed from 5531 South Four Peaks Place?
Yes.
State will move to admit 244.
Any objection? 244 is admitted.
And is that what then we see here in Exhibit 61?
It is.
Obviously, this is inside plastic, but this is the piece you're talking about.
Correct.
I want to talk to you a little bit about the rest of the house, and then eventually I'm going to come back to this. You told us that.
Would now be a good time to take our
Sure.
afternoon recess?
Yes.
Since we're close to 3, why don't we take our afternoon recess, stretch break, etc. Please remember the admonition. We'll resume in about 15 minutes.
All rise for the jury.
I don't even know what to say, people. And I'm happy for you. I can't imagine the stress. Just think, people, we got another hour of this. Because you know, I don't even know. I want to thank everybody who has stuck here with me, which I know you have, Patty. Yes. You know what my problem is? I am very impatient. I feel this prosecutor, I'm not hating on her, could do a better job and speed it up. She is acting like she's new like a glory. Yeah. Just saying. Just saying. I don't know. I think the most important will be the data. The data, cell phone data, and the coroner's report. That's what I think. I don't know. I could be wrong. I'm no doctor, I'm no attorney, I'm not a judge. None of that. I'm just somebody that gives my opinion. That's all. $130 8 pictures. Oh my gosh, you guys. I'm just so sorry. So sorry. Hold on a minute. All right, people. I'm trying to find some things for us. Hold on. Hey, hold on a minute. What's that lady's name? Hold on. Rachel. Sorry. Okay, I'm going to the attorney roster. That's what I'm doing. Where is she? I want to know how long she's been an attorney. Shoot. Okay, I'm still looking. I'm still looking. I need to find out. I need to know. Well, I know she was 2 weeks. Oh, here we go. Here we go. I found some stuff on her. Okay, she's a current member. Let's get her. Oh, there ain't much of anything. So she went to Arizona State University. I want to know. Why can't I know her? I know I'm just over here talking. I'm trying to find information, people. Yeah. Power, money, sex. That's what it was all about. Okay, 2018. She was a lawyer in 2018. Okay. Hold on. Uh-oh. I will tell you this about Trina. She is a big supporter of the Arizona Special Olympics, just so you guys know. Okay? And that was in 2018. She's been a lawyer for 25 years? Holy crap. No misconduct found in 1999. Dang. She'll look over it. Oh. Uh-oh. There was a lawsuit. Okay, there was a lawsuit, people. 5/11/2021. What was it for? Oh, man. Okay, so So the Dominique Brown versus her, what happened? It was against Trina. It was dismissed. There's 4 defendants, the police department, and 2 other people. Let's see what else. What else can I find out? All right, she's born in 1972. No way. No. She is not 53 years old. I do not believe that. Absolutely not. No. No. Oh my, hey, people. There is no way she's 53 years old. I don't believe that. I don't believe that at all. Hold on. Let me do some more research here. That's crazy. No way. Interesting. Boy, they really cleaned up the internet for her. I can tell you that much. Holy crap. So, my bad. She's been an attorney for a very long time. Very long time. My bad. Okay. So she was defendant in another case in 2024. What happened? Let's see. What happened? I'm not going to pay to read it. Come on now. But January 7th, 2025, there's another document, and it went to the appeals court. So there's that. Let's see how much money she makes. Let me find her. Oh my God, there's a lot of lawyers. Well, they all make anywhere from $250,000 on up. Okay? And that is as of 2023. Okay, 2015, she was making 110,781. Yeah. Well. And that was in 2015. Okay. Anyways, so she's been an attorney for a long time, everybody. Yeah. Ouch. Oh. No one believes I'm going to be 49. I don't believe it. But look at that lady. She don't look, no way. She's not 53. There's no way. But yeah, it is her. Okay, they should be back any time now. You would think, right? Oh, I already read that. I got the worst headache in the world, you guys. Oh my god. Any day now. Any day now.
Make your dog a Quattro dog.
Okay, what'd they do? Forget about us? It's been 20 minutes. 20 minutes. Can you guys imagine me on the highways? Can you? I think they forgot about the sound now.
Did you note here?
So there was again another bag, and more specifically, there was a pistol that was laying on the floor.
We start with 72 here. Was that just like a garbage bag with some clothes in it?
Yes.
So of more relevance to you was what was next to it?
Correct.
What did you find there? What is this orange thing there? And we see a whole lot of placard numbers.
Right. So the placard numbers are obviously identifying particular items that are going to be seized as evidence. That we have the orange bag with what appears to be a gun box inside, and then we have the pistol. And the three placards next to the pistol are specific for the pistol itself, the magazine from the pistol and potentially the chambered round in the pistol.
So 74, is that a close-up of that pistol?
It is.
What kind of pistol was that?
Pardon?
What caliber was it?
It's a 45.
Is that the same caliber as the casings that you had found in the front room next to Charles?
Yes.
Does this show another angle of that pistol in 75?
Yes, looking at the top of the pistol.
When the pistol, as we see, is picked up in 76, the individual's wearing gloves. Why is that?
Again, to help preserve the evidence in the event that DNA were to need to be done, we could articulate that we did not touch it with our bare hands to impart our DNA onto it.
Are you visually looking at this gun to see, and this is 77, if there is any visible biological evidence, blood on this gun?
Yes, we do look at them to help determine that.
And did you observe any biological evidence, any blood or what appeared to be blood on this handgun?
No, ma'am.
If you had observed that, would you have noted it and photographed it and documented it?
Yes.
Now, when you got this gun, was it loaded?
Yes.
And in 78 and 79, is that photographs of the magazine in the gun?
Correct.
So when we talk about the magazine, I'm going to go back to showing Exhibit 76. Where is that in this picture?
So you can see the base of the magazine at the bottom of the grip, close to what would be the individual's left thumb. There's that black piece of plastic that extends horizontally at across the base of the grip.
And so that's the magazine that you then took out that we see in 79.
Correct.
Okay. And why is the magazine removed?
Well, we have to make the weapon safe, and that's the first step in making it safe, is to remove any more source of ammunition that could feed into it.
Was there a cartridge or a live round in the chamber?
Yes.
So how do you make that safe then?
Well, the only way you can is to manipulate the slide to force the extractor to pull the cartridge out, and the ejector kicks the cartridge out.
Also in this photo, there was this orange bag, and you had told us that inside of it, we can kind of see the corner here. We see it better in 82. Did you remove an item from that orange bag?
Yes.
And I'm going to show 83, 84. What is that we see there?
That is a gun box that is consistent with the firearm that was laying on the floor.
So consistent with the 45 caliber handgun.
Correct.
And that was inside this orange bag. Was there any live rounds? And I'm going to show you Exhibit 85, also in that orange bag.
Yes.
And a closer up of that, was that another 45 caliber round?
It is.
And so when we say it was live, it hadn't been fired yet.
Yeah, cartridge has not been fired.
We start then by having my paralegal can take up exhibits 237 or 246. You can approach them at 237 and 246. Do you recognize 237 and 246?
Yes,
And is that the gun and the magazine that we see here in Exhibit 76?
it is.
The gun that was found in that pink room.
Correct.
State will move to admit 237 and 246.
Any objection?
Is Mr. Coons saying that he didn't take those, but he recognizes them from being in evidence? Is that correct?
I think he testified he recognizes them to be the same items from the scene.
No objection.
237 and
246.
237 and 246 are admitted.
Now I have my paralegal approach with 247, 248, and 236. Sorry. Do you recognize 247, 248, and 236?
Yes, I do.
And are those what we saw in Exhibit 83, the gun case, as well as in 73, the orange bag that the gun case was in? And hold on. What we see in 85, the single live round that was found inside that bag.
Correct.
State will move to admit 247, 248, and 236.
Any objection?
Just a foundation, Your Honor. If he could give a serial number or something that could authenticate those.
Well, he testified that those were the items that he recovered from the scene, so I guess you can question him about that on cross. Give me the numbers again.
247, 248, and 236.
Those items are admitted.
I'm going to show you, as you continued sort of in this hallway, Exhibit 88. Do you, can you put us into perspective of where that is? I'm going to put 19 sort of back up. Where is, what we see, this room with the blue on it, Exhibit 88?
So those two doorways would be on the south side of the hallway that leads up to the pink or maroon room. Specifically, the blue one would be the most southwestern bedroom of the home, and then the other doorways to the hall bathroom.
Okay. So again, did you go into room, this blue room, and look for any potential items of evidence?
Yes.
So in the room with the sort of child themes on it, did you find anything bloody in there?
No, ma'am.
Any ammunition in there?
No.
In the pink room, we saw the gun. Did you see any, did you look in the floor of that room to see if there was any blood drops in the pink room?
Yes.
So I'm going to go back 1 second to 87. So on this floor and the bed and around here, did you notice any blood in that room?
No.
No blood swiped across a wall?
No.
No blood on that orange case?
The orange bag?
Correct.
No.
No blood on the the black case for the gun?
No,
Or the extra magazines that were in there, any blood on those?
no, none seen.
So then in the blue room, did you do the same sort of thing? Look to see if there was any bloody clothing, any blood swipes, any blood drops, that sort of thing in there?
Correct. No items of bloody anything was discovered in there.
Okay. And nothing on the floor either?
Correct.
When we go to 92, you said that was the hall bathroom next to it?
Yes.
Do we see that in 93 and 94 here?
Yes.
Did you look in everything, like even the sinks, to see if you saw blood there?
Yes.
Along the countertop to see if you saw blood there?
Correct.
Did you note any bloody items, any that was anywhere in that bathroom?
I did not.
When you were walking down that hallway to those rooms, did you look on the floor there to see if there were any blood drops or blood trails or swipes of blood on the wall?
Yes.
Did you observe any there?
No.
So 98 here, can you put us in perspective of what we're seeing?
So this would be towards the feet of the body, where the kind of the hall splits to the kitchen and then to the bedrooms that we were just discussing.
Okay. 99, is this like a lanyard that was hanging on the wall there?
Yes.
So wasn't knocked off or anything?
No, it's where we found it.
And as you go through 99 there, is that how you entered, one of the ways you could enter into the kitchen?
Correct.
And is this sort of a view of that?
Yes.
So in the kitchen, did you look on the floor there to see if there were any blood drops?
Yes.
Along the cabinets to see if there were blood drops there?
Yes.
When you got to the sink, I'm going to put exhibit 103 and then 104. Did you observe a small amount of what appeared to be blood on the faucet itself?
Yes.
Did you look sort of as well in the sink itself to see if there was any blood there?
Yes.
Did you observe any there?
Did not see any visible blood.
Now, when you're going through the house and looking to see if you note any bloody items or any other items of evidence, are you looking in things like trash cans?
Yes.
So was this a trash can in the kitchen, for instance?
Yes.
And did you note any bloody rags or towels or anything thrown in there?
No, ma'am.
You said that there was also sort of a living area in there.
Correct.
I'm going to put up exhibit 112 to get a better perspective of that. So is this the doorway we were talking about?
Yes.
And so the kitchen here opens up into the living room.
Correct.
Did you look through that area to see if you saw any blood on the floors?
Yes.
Did you observe any?
No.
Did you look through that area to see if there was any blood on any of the furniture or walls or anything like that?
Yes.
Did you observe any of that?
No.
In exhibit 111, where does this doorway lead?
That leads back out to the mirrored room, the main room where the body is.
So when we were talking about the two doorways, one sort of directly into the kitchen and the other sort of more towards the end of the kitchen living area.
Yes.
This is what you were talking about.
Correct.
And in exhibit 113, can we see sort of both of those doorways?
Yes.
Okay. And 114, overall perspective of that.
Another perspective of it, yes.
So throughout this whole area, again, you're looking for anything that might be relevant because you have one chance to document it, correct?
Correct.
When we talk about 115 and we talked about the original layout of the house, Is this that front entrance area again?
Yes, it is.
And where are we looking in this perspective?
So you were looking in a north direction.
Where does that head towards?
It heads towards the garage, the master bedroom, and I believe a room that could double as an office.
So when we go along this wall here that we see in 115, 116, 117, is this the sort of what we would call office or playroom?
Yes.
Okay. Did you look through there, see anything bloody in there?
We looked and found nothing.
Was there like a powder room in this area?
Yes,
And did you search that as well?
it was.
And again, you're looking in sinks and in trash cans?
Correct.
And did you observe in 121, 122, the trash can and toilet and sink, any bloody items there?
No,
Was there a laundry room in this area?
there was.
And I'm putting up 123 and 124. Did you look through the laundry area to see if you saw any bloody items in here?
It was looked through, yes.
So although there's some clothing and some folded towels, none of those had blood evidence on them.
Nothing that stood out with blood evidence, no.
And then again, even looking in the trash cans that we see in 126 and 127.
Correct.
One 128, are we now heading into the master bedroom?
Yes,
129, was there sort of an office setup in there as well, 130?
correct.
And are you again looking through the floor, looking everywhere for any items of evidence?
Correct. Anything to indicate that what happened in the other room transferred into this.
Okay. Or any cleanup from after it?
Correct.
As you went through this, did you do the same sort of thing, looking through the floor and walls, 132, 133, for any blood evidence?
Correct.
Did you observe any in the bedroom?
No.
Do you go into the master bathroom and check there as well?
Yes.
The 134, 135. Did you observe any evidence, blood evidence in the master bathroom?
It did not.
And again, checking even the toilet itself as well as the trash can
Yes.
that we see in 137 and 138. So other than the one drop or whatever smear of blood on the kitchen faucet, did you see any other blood evidence at the scene?
No.
Let me put that in a different way, other than what was around Charles's remains.
Correct. No trails, no swipes, nothing that other than the sink faucet in the kitchen and the area where the body was.
So you told us that you cleaned up the blood there and you saw that defect in the ground that was consistent, or in the flooring that was consistent with a bullet strike, correct?
Correct.
When you were looking at this scene, actually I'm going to start with 15. Did you note injuries to Charles Vallow himself?
Yes.
On the front of him, where did you note the gunshot wounds to him?
Immediately before the medical examiner arrived, the only visible gunshot wound was in the lower left abdomen area.
Did you learn one it was in the chest underneath some of the medical debris?
Yes.
When you are looking at this scene, are you able to utilize part of your shooting reconstruction training to try to determine any type of trajectory, or if anything is consistent with trajectory based upon the scene itself, items that you are able to view there?
I do try to apply my knowledge of that to the scenes as I go to them and go through them, and with whatever evidence or information comes directly back to me.
Are you relying on, for instance, the location of Mr. Vallow?
That's part of it.
Are you relying on the location of the casings?
That's another part of it, not a major part, but it is another part.
Are you relying on the location of the projectiles?
Yes,
When the medical examiner came, were you also able to see exit wounds on Mr. Vallow?
yes, in conjunction with also the chest wound.
Okay. So when the medical examiner came, you saw a second injury to the front side of him.
Correct.
And where was that approximately?
In the sternum,
So for us, somewhere in,
about the center, maybe roughly the center of the chest.
and the other one you said was in the abdomen.
Yes.
When the medical examiner was there, where did you observe other gunshot wounds on his back?
I observed another one that would have been just to the left of the spine, and then another one that would have been by the left shoulder blade scapula area.
Now, given the number of casings, did you start with an idea that there might be two shots?
Yes,
Given the number of wounds on Mr. Vallow, did that appear consistent with that theory?
very much so.
So 2 entrances, 2 exits?
Yes.
When you saw the projectile that you recovered that we see in Exhibit 20 on the side over here that entered into that baseboard, given the injuries to Mr. Vallow and the projectiles and the location of this, were you able to determine any consistencies of where the shooter may have been when that occurred?
Approximate location, yes.
And how did you do that?
Based on the wounds to Mr. Vallow, the location of where the projectile had ended up, and where the casings were, the working theory at that point was that the firearm ejected the casings to the right, striking the wall where that has the curve there, and bounced back towards the west wall. The projectile would have continued on a relatively straight path and embedded itself in the baseboard at the other end of the room.
So would that have put the shooter somewhere in this area?
Yes.
And so that to you seemed consistent with one of the shots having gone through him and ended up what we see in Exhibit 20 over here in the baseboard, Mr. Vallow being somewhere over in this area.
Correct.
Okay. Given the information that you obtained, let me ask you this. Given the information that you saw at the scene there, again, with the casings, the injuries to Mr. Vallow, both to the abdomen and the shoulder, and then after you cleaned up the blood, the damage to the floor underneath the location of his left shoulder, were you able at that point to start have any concept or have a idea of what would be consistent with where the shooter may have been and where Mr. Vallow may have been for that shot?
Yes.
What did you base that on?
Again, a lot of the factors that have been discussed, the location of the projectile, item number 4, the defect in the floor that was underneath him, the location of the second casing. It was all consistent with the shooter having been at the feet, not necessarily right upon the feet of Mr. Vallow, but in that direction, close enough so that the projectile could again bounce off that wall and land on the west wall.
The projectile or
The casing, sorry.
When you were looking at this scene, I'm going to put 56 up. Obviously, there's no exact, I'm going to move Mr. Vallow this way just to kind of be looking the same direction. Did this defect appear to be in the area of Mr. Vallow's shoulder?
Yes.
Now, Mr. Vallow had been rolled a couple times by the time you cleaned that scene up.
Yes.
So you didn't like stick a rod through him there and see if that worked?
No, that would be inappropriate.
Are you even allowed to do that?
No.
Does a medical examiner frown on that?
Yes, the body is theirs by law.
So you're basically able to look at where he was located and say that that is consistent with being underneath his left shoulder.
Yes, and we did take measurements of the body before it was moved.
All right. So when you measured where the body was and then you cleaned up that blood and measured where that projectile divot was that consistent with where his left shoulder was?
Yes.
Given that information that you had at that time, were you able to draw any conclusions as to whether or not the evidence was consistent with Charles Vallow being laying on the ground when he was shot?
Very much so in the position that you see him. He was the second shot that entered the abdomen would have been where he was lying.
Did you attend the autopsy itself?
I did.
And when you were at can you tell us what it means when you attend an autopsy as a detective?
So as a detective, we go to the medical examiner on the date that they're going to do the autopsy. There is the autopsy suite itself where the doctors and technicians work with the bodies. Observers will be outside of that suite, but able to communicate with the staff. There's a window where we can see everything that's going on. And like I said, we can communicate either by a phone that's on the wall or they'll come around and talk with us. We have the ability to observe everything that transpires. There's even a camera overhead that we can manipulate to get a different view. Say the feet are toward the way.
I was going to say inches.
Yes.
Not feet, but inches.
Correct.
And so would that be a normal trajectory from hitting the wall to where they landed?
I am not surprised by seeing that, yes.
According to how fast they would be going. How fast does a casing come out of a gun? I don't really know.
I've never chronographed a casing coming out of a gun. I've only chronographed bullets. So I have no idea how fast a casing comes out. It doesn't come out with enough force to really hurt anybody.
So there weren't any divots in the wall or anything like that because.
There could be microscopic divots, but it'd be very difficult to find.
And you didn't find any that were visible to the eye?
Nothing that caught my eye, no.
So were you there at the time when Alex did the walkthrough?
Yes, ma'am.
And so you were there. Did he describe where he was standing?
Sustained.
Did he show you physically where he was standing?
Sustained.
Was there a wall right next to where he was standing?
Sustained.
Your Honor, I'm not asking for the truth of the matter asserted. I'm saying he observed this person standing in that place.
Well, you can ask him if he observed Mr. Cox standing in that place.
Okay. Did you observe Mr. Cox standing in the room where he told you that the gun was?
I observed him standing in the vicinity that he indicated.
And was that in the hallway or in the main room?
Right. If the question is in relation to Mr. Cox showing or recreating or demonstrating, then the objection is sustained.
Where did you observe Mr. Cox standing when he went through the walkthrough to?
Well, that's the testimony that I'm saying is a form of hearsay. So please ask a different question.
I'm trying to understand, Your Honor. So what the witness observed is not relevant?
I didn't say that. Let's do a sidebar.
Okay, I would love that.
Oh my God. This is crazy. Never mind. It don't matter. It don't matter. No, no, no. I can't hear you at your sidebar. Um, hmm. Misty, are you around or not? There's two other people that were supposed to be here today, and they're not. And they're not here. I see how it is. I see how it is, you two. Not you guys.
Detective Coons, where would you place the shooter standing in that room?
I would place the shooter in the area of where the curve of the wall was in the kind of the hallway entry area, somewhere in that general area.
So would you have it, what direction would you place him standing? Facing, I mean, not standing, but facing.
For which shot?
The first one.
The first one in a more easterly direction,
Mhm. And the second?
in a more northern direction with a slight deviation to the east.
So would you have him stepping forward? Is that what you're saying?
No,
What direction would you have him moving?
I didn't say the shooter moved.
You're just saying that he shot from a different angle?
Yes, ma'am.
Okay, so you think he was standing in the same location?
I don't know that.
So according to where you put him standing with the first shot, the casing bounced off of the wall to the right and landed to the left.
Correct.
And then where you have him standing in the second shot, the same thing happened.
Approximately, yes.
And how far apart were those casings found?
I don't have the specific measurement of how far apart they were. They were a few feet.
So they're a few feet apart.
Yes.
So if he was standing in the same place, would they be a few feet apart or would they be closer?
It depends on a different amount of things, like how was the gun being held? Was it canted to the side? Was it not? What the angle was. Could the shooter have moved? A little, but it would have been the same general vicinity.
But you said he didn't move, according to you.
I said I didn't say he moved.
So he could have moved because they were more than a foot apart, the casings found.
A little, yes. Would have been in the same general area.
So he could have taken a couple steps.
Perhaps. Could have slid the body sideways. Anything that you can do to the body, it could have been done in a short area.
And is that common in, I don't know with shooting, if it's that common with someone to shoot once and then move and shoot again?
I'll sustain it on speculation.
In your experience as a firearms expert who fires a lot of guns, right? Would that be a common thing to do?
All right, I'll sustain the objection as to speculation.
Let's talk about stippling. The first shot, according to you, had stippling. Is that correct?
No,
It did not have any stippling.
none was observed.
And the second shot,
None was observed.
no stippling was observed.
Correct.
Is that what's in the ME's report?
I believe so.
That there was no stippling? Can I have a minute, Your Honor?
Yeah, I really appreciate that. There's so many new people that are streaming this. It's just some of the people I talk to, we've been following this stuff since 2019. So shame on them, because I always come on their panel. Just saying.
When you were observing the autopsy,
Short break.
Why is she bringing up the autopsy? That guy has nothing to do with the autopsy. Thank you, thank you, thank you. It's all right. All right. See what else is going on around here. I wish they would just carry on with this and get going.
Detective Coons, you were the scene agent that day on scene, is that correct?
Primarily, yes.
Did you work for someone else before Chandler Police Department?
United States Army, Arizona Department of Corrections, a couple other little jobs after I got out of the Army.
Did you work for Gilbert Police Department at all?
No.
And as the scene agent that day, you talked about you were there. Did you write a report about that day?
Yes, ma'am.
When did you write that report?
I don't know the day I sat down to write it. It was shortly after the event,
So close to July 11th, 2019?
close to it.
Within a week, maybe?
Again, I don't recall when I specifically started typing that.
And when you arrived that day, who was there already?
Patrol officers,
Just them?
the fire department might have been there. Alex Cox was there. Other detectives arrived. I couldn't tell you the order of which everybody arrived.
And where did you park?
I parked north of the scene.
And then did you go directly into the house?
No, ma'am.
What did you do first?
We received a briefing of what patrol officers had learned. We learned that there was a body inside the residence, and we came up with an investigative plan.
Who did that debriefing to you?
I don't think anybody specifically ran the debriefing. We, as detectives, gathered around the patrol officers, and they informed us basically of what they had seen and what they had been told.
And who were those detectives with you?
Well, Detective Duncan would have been there with me. Detective Moffett would have been there. I didn't take a roll call of all the detectives there. Possibly Detective Inclin. I don't know.
Okay. And then where did you proceed after that debriefing?
Well, after the debriefing, I provided the information of what I had learned to Detective Kaminsky, who is still back at the police department, and gave him the information necessary to request a search warrant for the residence.
And then what?
We waited.
To get the search warrant?
Yes, ma'am.
To have it issued?
To see if the judge would issue it, yes.
And how long did that take?
Don't believe we got word back from the courts until it would have been probably between 11:30, 11:45, and then we made entry shortly thereafter.
So is it your protocol that you can't enter until the search warrant is issued?
That is what we do once the scene has been made secure, yes.
Okay. And then when you entered, who entered with you?
Myself, the crime scene tech, we were the initial ones. I think Detective Duncan might have come in with us as well, but that would have been the extent of the initial entry.
Do you know the name of the crime scene tech that was with you?
Jordan,
Is that the last name or first name?
the last name.
And then what did you do after that?
Well, after that, we continued to go with our normal process of having photographs taken. I did the lizard Q spheres. I completed getting information necessary for the diagram that was presented, and continued to just do our job.
So is that protocol to do photographs first?
That would be our protocol, yes.
And then what do you do after that? I know that you were searching for the blood in all the rooms. When did that occur?
That occurs after the initial photographs are done. and then we can walk through and look in the particular areas that's been photographed already.
Okay, so the photographs are finished and then you guys kind of walk through.
Or at least finished in an area that we can actually walk through, yes.
Okay. And then when did you set up the tripod after, how long after that?
So the tripod was set up after the area had been photographed. So that way I wasn't interfering with anything. And that way we're not having the tripod in our original photographs.
Oh, right. Makes sense. And do you think, so Detective Duncan was with you going through the house?
I believe he was there, yes.
So it was basically the two of you or three of you going through room by room, or were you split up, or how does that work?
We would have divided and conquered a little bit to make the search a little bit more expedient. But that, again, you're slowed to the time frame of what it takes to do the overall photographs.
So the photographs took about how long?
I don't ever look at my watch to see how long it takes because it's a big house, as you're aware. And I let the crime scene tech do their job. I don't push them and tell them that TikTok, there's nothing like that. It's do your job, we'll follow along.
Okay, and you guys started that process at about 11:45?
I think the actual time would have been closer to noon that we would have started that process.
And about how long did it take to go through the whole house, and about how long was that process?
Again, for me, I don't document how long it takes for any particular task because each scene is different. I just focus on doing the tasks. I rarely take a look at my watch to see how much time I'm spending on it because I want to do the job. I don't care about the time it takes.
And you did not pick up any of the evidence that was marked. That wasn't part of your protocol, is to take the evidence into custody. Is that correct?
Most of the evidence I did not pick up, correct.
And whose job is that?
We usually defer to the crime scene techs to do that. There are times that we will assist them with doing it depending on what the item is.
So that day, was it Jordan who did that? Was he the crime scene tech that took that evidence?
She would have been the one that was collecting at our direction, yes.
And so you kind of pointed out as the detectives, and then they pick it up and...
Correct, because they're trained how to handle evidence, how to package evidence, how to process. So we work in tandem together. We're the investigative body, and they're the scientific portion of it.
Makes sense. Okay, what time do you think that well, let's ask this. After you're done with the photos, and then you're done with checking the house, and all of the evidence is picked up and logged, then what else do you do at the house? What else did you do at the house that day?
Well, you just bundled that up into like tiny little package, but it took a long time to get to the point that you're talking about. So my day pretty much involved the scene. As far as ancillary jobs to go somewhere else or do other things, now my day was pretty much spent there on Four Peaks.
Correct. Yeah. So when did you leave the residence then?
We secured from the house sometime between 4 and 4:30 p.m.
And what other tasks did I miss that you accomplished during that 12 o'clock to the 4:30 time?
Oh.
I just don't know what you were doing in there. I'm just wondering.
Well, we identify the proper or the evidence items. We're looking for other evidence items. I am still doing the diagram, so measurements need to be done. We have to wait for the medical examiner to arrive because we can't do anything with the body until they show up. And then once they show up, we pretty much stop with the other projects until we can focus on the body and get the body out of there, because there aren't very many investigators for the medical examiner in the county, so we don't want to tie them up longer than we have to. And then we'll resume searching or identifying information, evidence, collecting it, and working our way to a conclusion where we can leave the scene.
So after searching the whole entire house, did you guys search the backyard at all?
It was searched.
Did you do that or did someone else do
I
that?
did not. We would have asked an officer to do it.
And what would they be looking for?
Any blood evidence, anything to indicate, based upon the information we had of the event that took place inside that house.
So when you made your assessment, you were able to leave after that assessment was made, that everything was accomplished?
Oh, what assessment are you talking about?
That all the evidence was gathered and collected?
That I was satisfied that we had collected what we needed to collect?
Correct.
Yes.
Yes. Okay, thank you. Oh, is it showing?
Oh.
I'm sorry.
Yeah, that's, actually, let's just turn that off until we need it. Thank you.
So you stated earlier that the weapon, the type of weapon that was found was a .45 caliber?
Yes, ma'am.
Is that a semi-automatic?
It is.
Okay. How is that different from like a revolver? What's the difference between that?
The build itself, I like to use simplistic terms when I describe what a revolver looks like. Most people are familiar with a Western movie. So the wheel gun, that's a revolver. What you see modern police officers carrying these days are semi-autos. So that's kind of the analogy I give to people that don't know guns.
And what's the difference between when you're shooting a semi-automatic or shooting a revolver, how fast you can shoot? Does that make sense?
The speed on which somebody can shoot is dependent upon the shooter themselves, the skill level they have, the weapon they might be using. There are a lot of circumstances and things that happen to be able to qualify that statement.
Right. And you have taken many gun classes, right, that we heard of?
And I'm an instructor, yes.
And you're an instructor. So when you're taking a gun class, is it common for them to say, is it common that they tell you to shoot center mass? Is that a common term?
That is what we train as police officers, is to shoot center mass. It has the highest probability of guaranteeing a hit on the adversary that you're trying to shoot.
Right. So if you were being attacked, you should point at center mass. Is that correct?
That is what's trained, and because stress can obviously create issues, but yes.
Is it a common term to say to center mass?
No,
In
that
training?
that is something that I've heard, but I wouldn't classify it as common.
Would you teach that in your class?
It depends on what class is and what we're actually doing. If it's standard officers, no, I don't tell them to always shoot to center mass, no.
If it was a novice who was like taking a gun class for the first time, would you teach them that?
No.
What would you teach them?
You would teach them to shoot till the threat went away, and that can be with one shot. It can be with more than one shot.
Okay, that's fair. So in this particular gun, the .45, When the shells are ejected, where do they go?
Out and away.
So in this particular gun, do they go to the right or to the left?
I've not test fired this particular gun. I believe that most semi-automatics do eject the casings out to the right. Whether it's high right, low right, I'm not sure. It could be farther forward, it could be farther back. I did not test fire this gun, so I cannot speak specifically to how this particular gun ejects, other than most likely to the right.
But it could go to the left?
No, not the way the ejection port is set up.
So no guns that are 45s could go to the left?
Certainly you could have a left-handed gun set up that it would eject that way. But the way this particular gun is set up, the ejection port dictates which way that's going to go. When the slide cycles back and that extractor pulls the casing back, the ejector is usually located on the opposite side of the extractor, and that will kick it out of the actual ejection port of the slide.
So for someone like me who doesn't really understand guns too well, you would say that a right-handed gun, they would eject out of the right, but a left-handed gun, they could eject out of the left.
And they're very rare to see.
And do people have left-handed guns? I guess I never really thought about that.
Some people do.
If you're left-handed, you'd want that, I guess. Okay. So in this particular case, when you said in your report that the shells bounced off the wall, they had gone to the right, like they were supposed to. Is that correct?
That is what I was operating off of, yes.
And then they would have bounced to the left.
Yes, because that makes sense.
And they would have landed to the left of my husband. Is that where they were found?
Along the west wall.
Okay. But how close to the wall were they found?
The pictures show where they were found. They're relatively close to the wall, inches away.
I was going to say inches.
Yes.
Not feet, but inches.
Correct.
And so would that be a normal trajectory from hitting the wall to where they landed?
I am not surprised by seeing that, yes.
According to how fast they would be going. How fast does a casing come out of a gun? I don't really know.
I've never chronographed a casing coming out of a gun. I've only chronographed bullets. So I have no idea how fast a casing comes out. It doesn't come out with enough force to really hurt anybody.
So there weren't any divots in the wall or anything like that because.
There could be microscopic divots, but it'd be very difficult to find.
And you didn't find any that were visible to the eye?
Nothing that's caught my eye, no.
So were you there at the time when Alex did the walkthrough?
Yes, ma'am.
And so you were there. Did he describe where he was standing?
Sustained.
Did he show you physically where he was standing?
Sustained.
Was there a wall right next to where he was standing?
Sustained.
Your Honor, I'm not asking for the truth of the matter asserted. I'm saying he observed this person standing in that place.
Well, you can ask him if he observed Mr. Cox standing in that place.
Okay. Did you observe Mr. Cox standing in the room where he told you that the gun was?
I observed him standing in the vicinity that he indicated.
And was that in the hallway or in the main room?
Right. If the question is in relation to Mr. Cox showing or recreating or demonstrating, then the objection is sustained.
Where did you observe Mr. Cox standing when he went through the walkthrough to?
Well, that's the testimony that I'm saying is a form of hearsay. So please ask a different question.
I'm trying to understand, Your Honor. So what the witness observed is not relevant?
I didn't say that. Let's do a sidebar.
Okay. I would love that.
I don't think that guy likes Lord. They're going to come back and say, we'll just come back tomorrow, which is fine with me. Just saying.
Detective Coons, where would you place the shooter standing in that room?
I would place the shooter in the area of where the curve of the wall was and the kind of the hallway entry area, somewhere in that general area.
So would you have it, what direction would you place him standing? Facing, I mean, not standing, but facing.
For which shot?
The first one.
The first one in a more northeasterly direction,
And the second?
in a more northern direction with a slight deviation to the east.
So would you have him stepping forward? Is that what you're saying?
No,
What direction would you have him moving?
I didn't say the shooter moved.
You're just saying that he shot from a different angle?
Yes, ma'am.
Okay, so you think he was standing in the same location?
I don't know that.
What's going on here? We already heard this. What happened?
So according to where you put him standing with the first shot, the casing bounced off of the wall to the right and landed to the left.
Correct.
And then where you have him standing in the second shot, the same thing happened.
Approximately, yes.
And how far apart were those casings found?
I don't have the specific measurement of how far apart they were. They were a few feet.
So they're a few feet apart.
Yes.
So if he was standing in the same place, would they be a few feet apart or would they be closer?
It depends on a different amount of things, like how was the gun being held? Was it canted to the side? Was it not? What the angle was. Could the shooter have moved? A little, but it would have been the same general vicinity.
But you said he didn't move, according to you.
I said I didn't say he moved.
So he could have moved because they were more than a foot apart, the casings found.
A little, yes. Would have been in the same general area.
So he could have taken a couple steps.
Perhaps. Could have slid the body sideways. Anything that you can do to the body, it could have been done in a short area.
And is that common in, I don't know with shooting, if is that common with someone to shoot once and then move and shoot again?
I'll sustain it on speculation.
In your experience as a firearms expert who fires a lot of guns, right? Would that be a common thing to do?
when, where, circumstances.
All right, I'll sustain the objection as to speculation.
Let's talk about stippling. The first shot, according to you, had stippling. Is that correct?
No,
It did not have any stippling.
none was observed.
And the second
Why,
shot?
why are they playing this all over again?
Observed.
Correct.
Is that what's in the ME's report?
I believe so.
That there was no stippling? Can I have a minute, Your Honor? When you were observing the autopsy, the ME didn't say anything about stippling?
I don't recall any mention about stippling.
And you didn't have a discussion with him about it?
We would have if he'd observed any.
And so if he said that to someone else, you would be surprised?
I don't know what he had in his notes. I didn't author his report.
Can you describe stippling for us? What that is?
Sure. It's basically a combination of particles that come out from behind or follow the projectile as it exits the barrel. A lot of times it's partial burned or unburned powder, and it's a short distance phenomena, so the person has to be extremely close for the pattern to actually present itself and the particles embed in the clothing or the skin.
So if stippling was found, how far away would the gun have to be from the victim
That depends on the gun.
on this 45 semi-automatic?
I am not a expert on the stippling patterns. That is something that we would have to send to the lab for. And what they would do is they would test it with witness panels at different distances to give that information.
Is there an estimate?
That's where it would come in. Usually the medical examiner, if they observe stippling, will give an estimate of close or contact.
So would you be surprised if he said 2 to 4 feet?
If that's what he says.
That if there's stippling, then the gun would have to be 2 to 4 feet.
It's possible, but I wouldn't hold my hat on that, no. I would have to have the gun tested for that.
Okay. And
Is this a good spot to break for the evening?
Sure, Your Honor.
I mean, I'm not cutting you off. If you want to ask a few more questions, that's fine.
Nope, that's fine.
All right, we'll take our evening recess. Members of the jury, please remember the admonition. I'll remind you to specifically avoid any outside information, any information about this case outside this courtroom. And we'll see you tomorrow at 10:30 a.m. Thank you.
All rise for the jury.
All right, the jury is no longer present. Please be seated. Will you inform us in the morning of exhibits you anticipate that you might need during the rest of your cross-examination prior to us starting? Because there are a lot of photographs to try to sift through to get the ones that you may need. You have a habit of when a witness answers a question to add something on the end of their answer. For example, during this witness, you said, I wasn't aware of that. Another time you said, I don't know much about guns. On previous witnesses, you've said, that's what I recall, or I'm not really sure. When you say those types of things, it's a form of testimony. Okay, so I'm going to caution you to try to refrain from doing that. After the answer, just move on to your next question, okay?
Sure.
All right. Anything else from the state?
Yes, Your Honor. I received information that a couple different detectives have been subpoenaed and asked to appear tomorrow. There was no phone number for them to call in to say they received their subpoena, and they were asked, and I advised them that they need to come here, but I am happy to pass that along, or I wasn't sure if they need to come here tomorrow or not, but I've been asked to.
All right, so I'm clear. The defense subpoenaed a few detectives. The information in the subpoena says they need to appear tomorrow.
Correct, along with one civilian who also reached out to us, Joe Pongrass.
Okay, but was there
Detective Moffett and Joe Pongrass are who I'm aware of, who were given a subpoena with no number to call and confirm, just says to come here tomorrow.
It was my understanding that the subpoenas were to say to call to check in beginning on the date tomorrow, because we didn't know where we would be at this point in trial.
Who do you want them to call to see when they actually need to be here? Because obviously the state's not going to finish their case this week, I don't think.
Correct.
I can give the defense their numbers. I don't know how, I just wanted, I mean, obviously if she wants them to come here, and I will tell them that. I just was passing that along as that is obviously.
So it sounds like the subpoena may have been missing some information of who they should check in with to make sure they report on the correct date and time. So who do you want them to call? Those witnesses, your investigator?
Yes.
And okay, so we don't need to put it on the record, but the state will pass the investigator's number along, name and number along to those witnesses, and they'll call your investigator, but you're saying they don't need to report tomorrow, correct?
Correct. I didn't get to see those subpoenas. They went straight from my paralegal to OPDS, so I'm not quite sure what they said.
Okay, so I'll direct the state to provide that information, contact information, and that those witnesses just need to stay in contact with the investigator.
Perfect.
All right, anything else for before tomorrow?
No, Your Honor, that's it.
From the defense?
Nope.
All right, we'll be at recess. Thank you. You can sit down.
What time do you get back?
All right. So there's that, people. What a day. What a day. What a day. So I just want to thank everybody that was here, either in the bushes, in the chat, whatever it may be. But I got to get going. Yeah. Have a good night.